be easier to understand if you actually do it on the mobile. The website is openep.com. You can put in the Google openep, OPENEPI.com. So in that, you see on the left side menu, there is option of sample size calculation. Is it visible in the mobile? I don't know how it looks in the mobile. There is option of sample size. So you see, they have given the softwares for different study designs under sample size. One is proportion, unmatched case control study design, cohort study, randomized control study, and mean difference. So all these four different types, you can calculate the sample size. And I feel this is the easiest one, and anyone can use it. There are so many softwares which are available, but this is the free version, and it is also approved by WHO for all the epidemiological studies like observational. So the first study is proportion. I'm going to show you only for two types of study design, because I know you people are doing only two study design, either observational study or intervention study. So we'll discuss only those. We'll not make it more confused. So first one is proportion. Now yesterday I told you about prevalence. So if you want to find out the prevalence or rate of something, or the incidence from the population, you can use this proportion option under the sample size. Now the good thing about the OpenEP is you just click on the proportion. See, there is guide given on the first page itself. They will tell you what is the use of this function, and for which study designs you can use. They have given the example also. Can you see this type of table on the first page itself? So in that, you see there are 5 rows. First one is population size. So how much population you are going to study? Okay, how many people? That is like, suppose if I want to find out the diabetes and pre-diabetes in Ahmednagar city, so I don't know how much population I am going to study, or I don't know how much is the population of Ahmednagar. So in that, you can keep the number what is given in the software as it is. Okay, if your guide says you study 500 surgery patients, and out of 500 then you find out what is the prevalence of particular complication, then you put 500 in the population. So that is not fixed population. You can put 10,000 also, or you can keep 1 lakh also. Out of those 1 lakh, then we are going to find out. Now from our side, in this software, we need only one value, that is anticipated frequency. Other values you can keep as it is, you don't need to change. All the values like confidence limit, they have given 90%, that is 100 minus 5, and design effect is 1, that is for random sample. So you keep as it is, don't change anything, just put the anticipated frequency. Now as I told you, from where we are going to get the anticipated frequency or prevalence? Previous study, or else you just find out from 10-15 people, you study 10-15 people and you find out how many are affected. Suppose for example, now I'm finding out the diabetes prevalence, and I got a study from Maharashtra state, and I found that the prevalence of diabetes in Maharashtra state 2 years back or 3 years back was 15%. So I'll just enter one value here in the anticipated frequency, that is 15, and then I'll click on calculate. Now you look here. First look here. See, there is the sample size is calculated at different confidence levels. Yesterday we discussed the term confidence level. Again, the values of confidence level are given. Like at 95%, the sample size is 196. Then at 80%, it is 84. So you can keep confidence level above 80 and above 80. But as you go above towards 90, the sample size will increase. So here I'll take 80% confidence level and my sample size will be only 84. Now you just try in your mobile, you put any anticipated frequency, like suppose if you want to find out the complication or the rate of any disease, and you just enter one value, that is anticipated frequency, and click on the calculator. You don't need to change any other value. If you want to change the population, you can change it. If you know the exact population, how much population you want, like 500, and out of that, I want to find out the population. Then you will use the population 500. If you not have to population size, you can keep as it is. Everyone got it? So you see how getting the sample size, how easy take the population level 80% sample that is the final fact. If you want to take 90% confidence level, that's it. So as you go up, the sample size will increase, but I think you can take 89 or 95. Now everyone got the now how to write about the sample size. You cannot just write the sample size is 98 because you know this. So you need to write what are inputs you use to calculate these samples. So I got the sample size 10. For that, the anticipated frequency used was 10%. The confidence level was used at 80%. Then the design effect was 1, and population size was that. Those restrictions are required, and then you just go down in the calculation. You have given the reference which formula is used. Can you see the formula? So by using that formula, this sample size is calculated. So even you can write the formula as I told you yesterday, how to write the or how to mention the calculation, and you can give the reference of OpenSea software because it is accepted by the for all the impedance of the don't know the population size, don't see that. They are given on the post page. Don't know or you're not sure about the population, just keep the number as it is. You don't need to change. So just keep to enter only one value in that source. Calculate like this, no one will question about the sample. So don't be trying to take 100, 200 or 300 like two qualities. If sometimes it is unequal also. Now suppose you got the sample size of 6 calculated, and if you are taking 120 or 200 people, what you are doing? The extra fee, the the population of samples which you are including is unnecessarily exposed to your internet, or there may be some economical losses from surgical material or that is economical problem. That is one of the reasons. So you should calculate scientifically and nobody question about it, right? All the details of that. Depending on your prevalence, some weeks prevalence very high, so immediate would happen. Like suppose if I'm doing the study on annual population in our area, whole of the hospital. So in annual population monthly period so the prevalence is very less. If I do the prevalence 3%, then I get sample size only 25%. Now you take the Aushore rate. You must have seen every patient above 3 Aushore rate because all are partners fighting. So if I do the prevalence of Aushore rate, prevalence as 30%, then my sample size will be around 200 or 300. So as the prevalence increases, the sample size also increases. That means study shows me. Any question about? I think all are doing opposite or intervention. Any question about observation? So now I will go to intervention. As she told, she is using 2 groups. So I'll just demonstrate about the interventional studies. See, this is the software for mean difference. There is for RCT there is one more option is given, but I feel we can go for mean difference. Now, as she told, she is comparing 2 groups. So when you're doing the intervention using 2 groups, you need 2 things. One is mean and standard deviation of one group and mean and standard deviation of another group of any one outcome. What is your outcome? What you are going to measure? How you are going to measure? Huh? ECG changes. Okay, so it will be in the numbers. Numbers. Okay, only like that. And number, then she will count how many positive, how many negative, like that. So it will be number in the end. Huh? You are going to compare. And how you are going to measure that? It is scoring. Yeah. Okay. So what you need to do, you just conduct a pilot study using at least five patients, 5 in one group, 5 in another group, and find out the mean and standard deviation of that group for that scoring and next group. So in this option, the confidence interval is given, power is set at 80%. If you want, you can set it at 90. Again, power 80 is acceptable. If you go up, again the sample size is going to increase. So the mean of one group you need to enter. So how much is the score total? Total score of that scale? 6. 1 to 6 total. No, there will be options 1 to 6, 3, 4 questions will be there. But how much is the total scoring? Is it 6 only?
maximum score किती होईल?
6च येईल का? Okay. ठीक है, no issue. So if we take a mean, suppose if it is coming 4.5 for one group, mean like 5 people you took and you divided the total score by 5. So we got 4.5 in group 1, SD somewhere 1.5, and another group we got the score around 3.2, and here 1.2 standard deviation. We'll just check whether we are getting or not. See, this is your sample size now. This will be the sample size if you enter the mean and standard deviation. So for group 1 it will be 18 and group 2 it will be 18. So total sample size will be 36. So how much duration you are going to give the intervention? How many days or one setting only? Okay. Understood everyone? So in intervention studies, you need mean and standard deviation. If it is available from the previous study, it is okay. Otherwise, you just conduct a pilot study using a minimum sample. If your study was, what was your study? You said it was intervention only. So you're going to give the intervention for one day or it will be given over the weeks. How many weeks? And when are you going to assess the people? Pre and post or after giving the intervention? Pre baseline you're not going to assess? No, ideally see in any intervention study, we need to assess the person at the beginning, that is baseline assessment, and you need to give the intervention for maybe you are giving it for 1 month and then again we need to assess the person. So now in this study, what will happen, the people will not continue. So suppose today you calculated your sample size 80 based on the pilot study. But what if the people drop out in between? 80 people will not continue. Then in that case, you need to add the attrition, 10% attrition. That is 80 into 10 upon 100. So it will become 3 or 4. So 18 plus 3, that is 21. Will be your sample size. So even if those 3 people doesn't turn out in between or they just leave the study, your sample size will remain 80. It will not become undersized study. That's why if the intervention is for long time, you need to add the attrition that happens. If it is one time study, like you're giving intervention, you don't need to give add the attrition because there will be no dropout. You are immediately checking the anyone else other than these two studies like Now, one last I'm going to show you about the correlation. Anyone is doing the correlation study? Correlation coefficient? Do you know about correlation coefficient? Hmm? Anyone knows about the correlation? So, like simple, if the BMI increases, I want to find out what is the correlation of BMI with the blood pressure. BMI, everyone knows, body mass index. So, I want to find out whether if weight increases, what changes occurs in the blood pressure. So, what I'll do, I'll find out the correlation. So, whether it is positive correlation or negative. Positive means if my BMI increases, blood pressure also increases. Negative is if my BMI increases, blood pressure comes down. So in that case, you need to do the correlation study, correlation coefficient. So in that case, here in this software, you just need to put the correlation, that is R value. Correlation coefficient is denoted by R value. So suppose here one example they have given, a pilot study shows that correlation coefficient between height and weight is 0.9. What will be the sample size if we want to test the hypothesis with 95% confidence and 90% power? So they just inserted one value, that is R value, and here the sample size we got is 10. So for finding out the correlation between any two values, we just need the R value from either pilot study or the previous data, and then we can find out the correlation coefficient. So like this, it is very easy. I'm telling you. So it is now you people are in the stage of writing the synopsis. Just follow all the scientific guidelines to calculate the sample size. See, in some cases, we get the sample size only 10 by calculation, and that 10 is also acceptable. Even for 3 years, we can work on 10 people. If the way of calculating is right, nobody can question that. So don't think that if I take 100, 200, it will be a good study. So I'll stop here now with this, but I'm available in the college anytime. You can just come down once your study design is final and your sample is final, means the population, what you're going to do and outcome. Then it will be easier to calculate. I'll help you to calculate the sample size. Okay. Thank you very much.
Thank you, sir. काय झालं ते झूम बंद झालं का झूम बंद झालं सरांनी कधी बंद केलं Okay. So for the next session, I invite Dr. Urmila Shinde ma'am. She is associate professor in the Department of Obstetrics and Gynecology, and she will be talking on literature search. Ma'am, please.
So good morning, everyone. So today I will be talking about how to search for the references. It is helpful for not only your thesis, but also for paper presentation and poster presentation that you will be doing. And thereafter also it will be important whenever you are seeing any important case and you want to go and read about it on the internet, then you need to find out some good references which are valid. So today we'll be talking about how to search for the valid references on internet. Okay. So why we need to learn this? Everything is on the internet, okay? But you have to know that there is a lot of things on the internet, okay? The information is exploding on us. So we need to know how to pick up what is valid, what is useful, and what is exclusive of what you want to know. And today's era is also changing, you know. Not only for the thesis, but once you pass out and you will join any corporate hospital or you will have your own practice of any government hospital, a lot of government hospitals also, they have all the data entry, which is now digitalized. Okay. Gone is the eras of OPD papers and histopath reports and everything. Everything is digitalized. So you should be well versed how to access that data also. It is also important so that you should be aware how to do this so that you can compile your data and thereafter present anything. It has a medical legal significance also. So becoming techno savvy is I won't say a necessity, it is now essential. You know, there is no way out of it. It's not an option in today's era. So you need to know how to go for looking for a valid and important information on the internet. So how will this help you? It will make you information literate. Okay, it is everything is there on the internet, right? But it will make you know that where I need to go. You know, if you go on internet and type something, even for other stuff, you must have Google search so many things. You must have found a lot of nonsense also comes up, no, along with what you actually want, right? Same is for the medical education also, medical profession also. Anybody can get up and put anything on internet about anything. They might be having a celiac disease and they will write their own experience. They will have some treatment which is not there in the book, and they will say, "Yeah, I got relief from." Anybody can put up anything. So once you type that and that comes, that you can't say, this is the treatment, I'm going to do it for my patients. Okay, so sort of a lot of rubbish information is there on the internet. Okay, so you should know where to, what access should be there. So what are the steps of finding an information document? Okay, how you should go. So there are 5 steps involved in this. First, you should know what you are looking for, right? What specifically you want to go on internet and you want to look for. What is your topic in a simple language? Second, you should know where to look for. As I told you, there are many blogs, many sites which do not give authentic information. I have seen a lot of my residents coming with these references, you know, and I'm like, my God, this is not a scientific reference. So you should understand where to look for. And third, how to look for. That is also important. Okay. And the 4th and 5th stage, that is evaluating of the information, that is the analysis of a document. That is not part of this lecture. It is only about searching. You should know what you are searching for. You should know where you will search for it. And third, you should know how you will search for it. Okay. So how to go for it, we'll see one by one. So first is what am I looking for? Okay. So you decide to go on internet and you already know the topic of your synopsis. Most of you must be knowing. Okay. So you know what you're looking for, right? So what you'll put the whole of the name of the synopsis title in your Google search. How are you planning to search for the references? The title must be the prospective clinical trial of this and that, you know, or comparatively trial or observational study, because we want to put everything in the title. We want to put type of study, we want to put the population, we want to see whether it is comparative, whether it is analytical. We want to do everything in the title. Like title should be everything. It should be conclusion, what this study is about. So you'll put all of it in the title, Google search. No, what you should do, you should ask a question. What is that PICO? P-I-C-O. You take your synopsis title in front of you and ask yourself this. What is the first? First P is for patient, population, or a problem. Okay. So in your synopsis, what group of population are you studying? Or what group of patients are you studying? What is the problem you are studying? Okay, we'll take examples of this, don't you worry. Okay, so that is the first. So that is the first thing you need to look for. What is the population or a problem that you are studying? Second, are you doing any intervention for them or any exposure for them? Or it can be diagnostic also, but something it is to be done. Like I'll give you an example. In a study of pre-eclampsia, role of uterine artery Doppler. Okay, I'm from OBGYN, so I'm more comfortable giving examples of that one. So role of uterine artery Doppler in prediction of pre-eclampsia in a primary gravida patients. Okay, this is the name of my observational. Okay, longitudinal. Now that longitudinal observation has no meaning. What my P says, what is the population? So it is, what is the it is primary gravida movement. I am studying primary gravida movement, right? What is the problem I am studying? I am studying pre-eclampsia, right? Is there any intervention I am doing? I am not treating them. In fact, I am predicting. So what is I am doing? I am doing a color Doppler for them. When they don't have pre-eclampsia, still I am doing color Doppler for them. And then longitudinally, well, I'll see whether they develop pre-eclampsia or not. Understood? So what is the intervention I'm doing for these patients? That is a diagnostic, that is a test I'm doing. So intervention does not always mean treatment. Are you getting what I'm trying to say? Okay, like you are doing KAP papers, knowledge attitude practice papers. Okay, what you do, you give 10 proformas or 10 question answers, you know, to the 10 question answers to the group of 100 women. Okay, right? And to know about their knowledge, attitude, and practice about contraception, right? Or anything, you know, PSM ka hai to about nutrition, agar opthal ka hai to about God knows what. I don't know anything about other departments. So, but are you getting? And then you give them a lecture, and then you again give them those this. Understood? And you see how much improvement in their knowledge and attitude and practice also. So they will say, no, first I used to believe this, but after this lecture, no, I realized it was wrong to put kajal in the, you know, eyes of baby. So the attitude has changed. Now the practice will also change. So that is an intervention. Are you getting? So intervention does not always mean a particular treatment. It can mean a diagnostic test also. So is that part of your synopsis? Okay, that you should see. Then third is comparison. Like some of the studies may be comparative studies, like a placebo or a control group and a case group, right? Like mine was that when I was a resident, it was comparison. I was doing thickly stained meconium stain like I was there, and half of them I will do amino infusion to dilute that meconium. Half of them I will not do. It was a control, and I will see the fetal and maternal outcome. So it was a comparative study. Most of you may not be having a comparative study. Okay, like it is just an observational study to see. Okay, or clinical profile. Most of the patients, people have clinical profile. Anesthesia, most of them are comparative study between the two drugs, right? Or it can be case or control, where where you are doing an intervention, another group you are not doing an intervention, and you are seeing what is the difference in the outcome. Okay, so the third thing you ask whether there is a comparison in that. Okay, and fourth you ask what is the outcome you are looking for. Okay, so in the thing that what I said. So what outcome I was looking, whether it can predict preeclampsia, right? Same way, we'll take one example. Let us say this example. Does nutrition therapy improve decubitus ulcer healing in elderly patients? That is your question. Okay, synopsis mein questions pada hai na tumko? Hai na, your research question. So that is your question. So what study must be an observational longitudinal study of nutritional therapy in the patients with decubitus ulcer in elder? That must have been the title of synopsis. Title of synopsis should not always contain this type of study and all that. If you see the previous one, not necessarily, but nowadays we are including everything. So this is the research question that comes from it. Okay. So now you tell me which is the population? Elderly patients. Are all elderly patients our population? No, it is the elderly patients with decubitus ulcer. Because in elderly patients, we can study millions of things. No, we can study hypertension, we can study diabetes, we can even study depression in them. You know, you can study n number of things in them. So what are we studying? We are studying a group of populations who are elderly with a decubitus ulcer. So that becomes your P. Understood? Have you not understood? Then what is the intervention we are doing? We are giving them nutritional therapy, right? Is there a comparison? No. It is not written whether it is without nutritional therapy, say compare kar raha hai, ya फिर nutritional therapy and second you are giving some drug. No, we are not doing. There is no comparison in it. So, and what outcome we are seeing? We are seeing the ulcer healing. Okay, and that is the efficacy of the treatment we are seeing. So this is the outcome we are seeing. Understood? You understood this? So from all of your synopsis titles or anywhere you want to do any paper presentation, okay, research or poster, before finding the references, these are the words that you will take out from them. So that will make your searching for references easy and more specific. Understood this much? So you now got the what you call as keywords, you know? Understood? So now you go where to search. Now you know what to search. I know I have to search these words. I have to search for studies which contain these words. Right now, question comes where to search. So answer is very simple on internet. Everything. So it's like what do you know something that internet doesn't know? Everything is there on internet. So I'll just put those words. Right? Can you go in a library where there is nothing marked? You know, just group of books are there. Stack like that, and you'll go. Can you go and find a book which you want? Have you? How many of you have ever visited a library? Well, for people who are coming in medical profession, that is quite a low number. And I'm not saying about the medical books. Otherwise, also, you must be reading books, no? Yeah, you should be. So you go in then, and you're like, no, today I want to read something related to science, and next day you want to read something like a fiction or fantasy, you know. So you go in that section, no? Or you'll just go in the library and you're like, no, I want to read now Harry Potter and Goblet of Fire, and where to search? No, I will start with the first book. Okay, it is this, then second book, then third book. No, till you finish like 2,000 books that are there in the library. No, you go to a particular section, no? Okay, so now where to search? So it is in the database which is there on the internet, right? Correct? So first, studying what is database, you should know all the documents that you are searching, they are divided into three types: primary document, secondary document, and tertiary document. I will also tell the significance of them in your research. Okay, so what is a primary document? Primary document is something that has appeared or published for the very first time in a electronic print or a normal print. Nowadays we are having e-journals, so like directly you can put it. Previously there was no such as electronic literature, you know. Everything was printed in the proper journals. Like when I had done my thesis, I had actually gone to library only and actually looked through all the journals, old journals, 20 years old. Okay. Nowadays, a lot of journals are only e-journals, what you call them. Okay. So these are the first document that has appeared on it. The first, what you call in simple language, you must have heard it by now, original article. You must have also told कि तुमको एक original article लिखना है, otherwise you cannot appear for your MS. Okay. Now it doesn't have to be original research. I'm not saying that. You can do that also, but then you will not pass in 3 years. But what I'm trying to say is that it has to be an original article. Understood? So it can be a journal article, okay, a research article, a technical report. Your dissertation is also an original document. You are doing that, no? In actual people, you are not quoting somebody else's study. Now you are taking your 50 patients, you are finding, hypothetically, you are actually studying 50 patients, you are actually seeing what are the results in them, right? So we are considering that as a authentic research, and we are thinking whatever you publish with that will be an original article. Understood? So this is an original article. Okay, Helicobacter pylori infection for prevention of peptic ulcer with PP inhibitors in elderly subjects. Okay, so somebody did that study. Whoever elderly patients were taking low dose aspirin, they gave peptic PPI, and they studied whether it can prevent the H. pylori infection and ulcer. Okay, they did that study. Okay, and whatever their findings, they submitted or they printed it. Okay, now what is the difference between the, now this one thing, now this original article when you are writing, okay, What we aim at, or what your PG guides will tell you, that whatever other people's, I told you, yours researchers are not original actually. Understood? Samjha? Lot of people have already done that study. But what your PG guides will tell you, or what is generally done, is that whatever others have already concluded, you make your results stand by that only. Are you getting? But original article is not supposed to do that. It is supposed to just present what you have found. Are you getting what I'm trying to say? So it may not go with whatever is the dictum or whatever is the guideline. Are you getting what I'm trying to say? It can be an absolutely different finding. Had not people be dishonest, there would not have been any discoveries or Are you getting what I'm trying to say? Otherwise, we are following the same thing. Somebody somewhere found, no, I don't think it is working. You know, then we disregarded that practice. So many practices have been disregarded over a period of time, right? So actually, this is the intention of an original article. Understood? So this is a primary document. Okay, it is about their findings. What are the secondary sources? Now what they do, they take all these primary documents together and they compile them, they segregate them as well as compile them, they index them, they label them. What does that mean? As I told you, you go to a library, okay, you want to read a particular book, right? But as I said, you can't start from the first book, you go in a particular section. So somebody has done that work, no? Somebody took that Harry Potter book or Twilight book or whatever book and said, this will go in fiction. Right? Somebody has done that work, right? Somebody has taken Shakespeare and said, this will go in literature, right? Are you getting what I'm trying to say? Somebody has taken anatomy book and said, Chaurasia will go in anatomy section. It will not go in medicine section. So that if you want to search for Chaurasia, when you go to anatomy, you will find that. So does the primary document change? No. But what has been done to that book? It has been segregated, first compiled and segregated and then indexed and labeled and categorized into something so that it will be easy to access. Are you getting what I'm trying to say? So what secondary sources? It is a source, it is not a document. What are the secondary sources? They are nothing but such libraries which are taking all of these original articles, okay? And they are compiling them, whether it is a research article, whether it is a review article, whether it is a case study, whether it is a case report, or it is a review of literature, okay? Then what is the topic of it? Is a pharmacology, it is anatomy, it is obstetrics or gynecology, it is about pre-eclampsia, it is about Helicobacter pylori. Are you getting? So that when we go to search for them at their sources, secondary sources, we'll be able to find them. So it is in these secondary sources that all of your research searching happens, because they have already done all the work for you. Understood? So now that you already know what words to search, and this is where you search in secondary sources. Because if you put it in Google, then what will come? Nothing will come, no? Right? So these are because they have already categorized all that. So you don't have to do anything. They will search. Okay, understood? Should I go to the next slide? So what is a tertiary source? Now tertiary source is, I'll make it like we have fan clubs, right? We have Harry Potter fan club, we have Twilight fan club, but then we have so many other fan clubs, right? And they have their own theories, right? See, I'm trying to make you all understand in your language, right? They have their own theories, they have their fan theories, right? Understood? How many of you are getting what I'm trying to say? You are getting, no? So we have all have a fan theory, we have a fan remakes also, right? Somebody ends up with somebody and we're like, no, we don't want that. We want that person to end up with this. So we have that also. So these are the people who have held a lot of time on their life, right? So they decide, no, I'm going to go further than this. People have already done their work and no, I'm going to go further and analyze it. So these are these people. Okay, people have done the research work. These people don't do the research work. We are not writing the book. We are fans. But we think we are smarter than them, right? So these people are not actually doing the research. But what they are doing, they are taking all the articles from the secondary sources, right? And they are analyzing them. How they are analyzing them is they will take the articles. Let us say the first Helicobacter pylori wala. So they will study how many articles are there similar. Okay. to actually study the role of proton pump inhibitors in the prevention of peptic ulcer. Okay, and they will find, let us say they find 1,000 articles. Then they say ki, out of this 1,000 articles, only 20% were authentically corrected. Like they had their ethics questions, it was double blinded, it was properly and for the research study population. You must be taught now how to calculate the N. Okay? Like you can't say I want to take 50 patients. No, it is not like that. To avoid the type 1 and type 2 error in a research, there is a particular minimum number of the patients you need to take, right? So they will say how many people have actually done that. Because people like you and me will take 50 is my favorite number. So I will just make a study comparing proton pump inhibitors and this. And when these people will find it, they're like, no, this study is disregarded. So we may have a publication. Are you getting? On the internet, in a so-called our own reputed journal. But when tertiary people will say, no, I will disregard it. It is not conducted according to the guidelines. Okay, right? Whatever. So they will do that. Then they will find, okay, so we find only 20% of studies are good enough. Okay, out of which, let us say 20% will come to some 200. So out of which 120 are saying, oh, it is effective, and 80 are saying it is not effective. Okay, and they will scrutinize this further. Whether the 80 is those who are saying what is the value. If you study any guideline, now that you are in PG, so I really hope that instead of reading only textbooks, whatever subject you are studying, you should read the guidelines. You will see they are very specific. If not in India, I feel very bad because our mentality is not like that. They write, even if they recommend like a low dose aspirin for prevention of preeclampsia, they will write A. That means a good level of evidence to support this. Are you getting? So that means to give us that recommendation, there is a good level of evidence. So we are recommended. Okay, there are some things they will write and they will write D. Well, like, okay, there are some case reports which say this is okay, but then it's up to the clinician to decide. But we strongly do not recommend it. Are you getting? So this is decided on this. These are the tertiary sources. So that's why they are far more reliable. Are you getting? More than original articles also. Are you getting what I'm trying to say? Because you will be finding plenty of original articles, no? Right? But these people are actually analyzing them. Understood? So what are these reviews, editorials, and these guidelines? So in your clinical practice also, please do try to include guidelines. And always keep on reading. It's not only about doing your thesis. That's why you should not search the references. You should search references to update your knowledge every now and then. So what to read? So this is what you should read. Samjha? And when you are now, it's not a time, otherwise I would talk on the guidelines or like how to actually, but that's a different topic only altogether. So in old days, I was telling you I was going to libraries. We all were okay. We were searching, and in internet we used to find some of the articles, but not e-articles. Today is so everybody is having journals. But these are the few of the common sites on which you can find good medical references. Okay, so everybody knows Pubmed. How you know Pubmed? You know, no? Huh? Then we have Popline, InMed, Scopus, Cochrane. Cochrane is the tertiary source. Have you heard of this Cochrane word? You haven't? In a book, foreign author book, Indian author books don't like that. They write causes of this, Foreign author books write this. Cochrane review stated that. So when that is stated by them, then that has a value because it is a meta-analysis. Have you heard this word during these two days? So this what Cochrane analysis is of tertiary source. It is a meta-analysis of all the research has been done. Understood this much? So these are the topics. Google Scholar and everything. So first is Pubmed, the most important one and probably the one which will you be using a lot. Why? Because millions and millions of publications are there, right? Like you'll find so many publications, you won't need to go to other sites much to find them. See, our aim is not to conduct this. Our aim is to get 100 references. So that your PG guide will shut it. I'm like, inadequate references. I don't agree. Only 30 and I got 100. Done. So we can just immediately start putting them and start making our bibliography. So plenty of references are there on this. They are original articles. That's not only, I told you, See, most of the people are having journals nowadays, and a lot of studies are getting published. I will not scrutinize or criticize them, any of their works, because who am I to know? Maybe somebody has actually authentically done something. What I'm trying to say is the thing that you will find on PubMed, that citation is very important because they are using only those journals who are very, very, very critical while publishing any article. Are you getting? It's not easy to publish a journal article in a PubMed index journal. Are you getting? They have almost sometimes over 70 to 80% chances of rejections. That means in a month, in a day, they get 100 articles at the request. They reject 80 of them. Are you getting? Because they are so critical. They will be so specific. So whatever you find out in this, these will be good level original articles. You know, something that will be uploaded by tertiary sources also. Understood? So that is an importance of PubMed. Then it is maintained by the National Library of Medicine, USA. So this is it. And if you go onto the page, you will find that there is a search window and there is another drop. This is a search box and this is a drop down menu. A lot of other options they come. So here is the where you put your key keywords in the search box. Okay. Can you see it? So then we have Medline, and these are going to be good in coverage only. But what is the problem with the PubMed Medline? That it covers most, as I said, it is maintained by the USA, like National Health Library of USA. So it covers most of the journals from that side, not European journals. Asian to chodi do, you know. But what I'm trying to say is they cover most of these journals. So whatever references you'll find, they will be with reference to that population or published in those journals, right? So it won't cover rest of the journals. Second, as I said, they have millions and millions of journals, right? And publication. So indexing is delayed. What I'm trying to say, like let us say an original article get published in a particular XYZ journal right now, which is a good journal, okay? And it is indexed with PubMed. Okay, that means PubMed looks into that journal, what articles are published. Okay, but PubMed has a lot of work to do. No, it is not the only journal it is seeing. So that indexing or labeling of that book will take time. You know, busy library, when new books come, that is not going to go on the shelf immediately. Are you getting what I'm trying to say? Are you getting? Same way in a loose library where there is hardly any work, the person is sitting all day. You feel 10 books are tuck. Okay. So indexing takes time. So a recently published journal may not be available on PubMed. Are you getting what I'm trying to say? So that is the thing. But I don't think anybody is going for something which is published just 3 or 4 months back. You know, you are too happy anything is published in last 5 years. But somebody who is doing a real research who needs something which is happening immediately, just see why it is important. Like people who are doing real research and they want to publish it. A lot of patent issues come out. Who has actually invented it first, and all that. Or whether like there are 2 people working at the different parts of the world, and they want to see who publishes this first because the credit goes to those people. So that way it is important, The PubMed recent publications may not be there, but 3 to 6 months, but that I don't think that is significant for you. But the second major problem is that it is very poor in psychology journals. So anybody who is in psychiatry resident, very poor reference outcome comes, because not a lot of journals they have indexed. And a lot of them are paid. That is the biggest problem with PubMed. You go, you find 10,000 references with related to topic. And out of this 10,000, 9,999 will be paid. And you have to pay. What's the point? Okay. Then these are the other sites as well that you must have seen many times. If you are really trying to search the references, again paid. You go enthusiastically, yes, I found, and then they say you have to pay this many dollars for 48 hours of access. But you can't even download it. You can only see it for 48 hours and what write it down. So these are the ones. Okay, so again, paid site, but it covers the European journals more. Indexing is less and good in pharmacology also and psychiatry. Okay, so if you want anybody from that subject, can go on this. Okay, understood? Then we have this Psych Info specifically for psychiatry. Not only it publishes original article, it also publishes dissertations. So if you are in a good luck, you may find your own dissertation in that. Then that's the thing. Then these are again the paid sites. Okay. This is a Popline site is there. It is for people who are from low and middle income countries like ours. And if there's a particular article, which is there on the Pubmed or some other which is paid, you can just try to put it in this site, and you put your country as India, and directly it becomes a middle income country. So if they have that article, they will give it to you for free. Okay, so that you can try your luck over there. I have another thing that I will tell you at it. Then we have Medno. Okay, it is for online and print journals. There are many sites are there. This is an important site, Indian Citation Index. It is an index of Indian journals. Okay, why it is important? Because no matter how many references you get, I believe most of them, at least some of them, especially which you use in comparison, you will write your discussion, should be Indian. Why? Because our population, our ethnicity is absolutely different from others. Are you getting what I'm trying to say? Samjha? Now I will tell you what. Again, an example from OBGY, but I'm really sorry, but I hope you can relate it to your subjects also. Like you must have read in undergraduate Pritchard's regime for magnesium sulfate in Eclampsia. All of you must have read it, right? Now, when the Pritchard regime, everybody's using, there's a lot of, and Eclampsia happens in India, not in USA. The person who had done that study had less than 25 cases. The Pritchard had less than 25 cases of Eclampsia. Understood? And we are seeing 25 in a government hospital probably in 10 days. Nobody did study over here. That's a different story. What was the problem that was happening? A lot of magnesium toxicity was happening. That's why people were very scared in India to give magnesium sulfate. Then somebody thought, maybe I should go and look at that original article. Because what we see in article, we see only conclusion. Isn't that? But that's not no. You should know the whole story behind it. And what is the normal weight of the American population? Isn't that about 60 kg? All the women in that study were about 60 and 70 kgs. So that is normal, that is not overweight for them. But Indian population, low socioeconomic group, they are 40s and 50s. How will that dose will not cause toxicity in them? Then people started coming with low dose regime. Now we practice low dose regime. Most of the institutes. Only if the patient is obese, according to us, that is above 60 kg, then we go for whole Pritchard regime. So how did that come? That we realized that the population is different. So that is why whenever you are doing your study, your research, some of the references has to be from the Indian, because our population is different. Understood? Our susceptibility to diseases is different. So that is one thing. So for that, to get Indian journals, you have this option. Okay. Then, this Cochrane database I already told you about. In your conclusion or in your discussion, if your observations and conclusion match with the Cochrane database, or you can actually quote it. Quoting an original article is not that smart unless and until it is the index with a good practice. Because I told you, two original articles may have absolutely different opinions. So just because one match with yourself doesn't mean that you both are correct and other is wrong, right? But as I already told you, this is a tertiary source. They analyze a hell lot and then they come out with a conclusion. Okay, we will recommend this, we will not recommend this, or there is a dicey situation over here, controversial. It is up to the clinician to look for the best interest. That is also they say. Sometimes you can actually recommend something. Sometimes they say, no, this should not be done. It was being done previously, don't do it. And third thing, there is not enough data for us to come to at a particular conclusion. So it's up to the clinician to use their own experience and a particular clinical scenario. So you can actually quote this. Understood? So this becomes a really supportive evidence to your thesis or any research you are doing or any paper presentation you are doing. Okay. And then we have Google Scholar and this Med India. A lot of this, and then you can even go to individual sites. Okay. You can just go type British Journals of Obstetrics and Gynecology. There must be so many journals for physicians and all that. And you go on them, and then that journal site will open like this. Okay. And then you can just, in the search indexes, you can just put the name of your PICO words, and then in that journal, if any of that related has been published, so that will come. Okay. So that way you can even go on individual journals. Then how to search? Now you know where to search. Okay. You know which words to put. But even if you do that, you'll have plenty of problems because you do not know specifically how to go for it. So that is what we are going to talk. So how to search? So let us say the keywords, we have calcium channel blockers, okay, and hypertension, right? So you decide to go on a PubMed. Okay, now I want articles related to this. Okay, so I already told you, here is the search box. Okay, so you'll write words over here, calcium channel blockers and hypertension, right? And here is the drop down menu, which will say ki mesh, matlab it's a medical term. Okay, but before going for this, just putting words, we'll know something called as Boolean logic, okay, which will help your search easy and more specific. So he was a British mathematician, and it's a very simple logic. Far too much credit is given to far simple things, I believe, you know. So in life, don't try to make it complicated. You find something very simple and you realize that people accept it more. So you'll see, no, this, what is this madam is talking, is so simple. It has 3 words, and, or, and not. Okay, and, or, and not, and they are always to be written in capital. Okay, so what does it say? That in between 2 words, if you put and while searching, and that's apples for your Google search also. For all the search database entries, it has been programmed like to use the Boolean logic. Okay, so it's not like that particular site will accept it, particular site will not. So if you put and in it, okay, then only the articles which has both of these terms will appear in your search results. Understood? Like there must be 10 million articles about CCBs, no? Starting from different comparisons, starting from their somebody must have written a pharmacological, which has nothing to do with the treatment part. Okay? Somebody must have done it on the structure, somebody must have done it in the animals. So many studies. And hypertension is also somebody hypertension with hydrogen they are studying. Unnecessarily that will pop out. But when you put and in that, only the articles which has both these terms, you know, the center one, that will only come. Samjha? So that will make it more specific. Second, or. Now sometimes something happens, you know, like we had this problem with one of our residents, that the topic that we had selected was not done before. Actually was not done before ever. It was about the labor analgesia. And what topics were there? Either they were studying epidural in comparison with IV paracetamol, or they were studying IM tramadol, intramuscular tramadol with IV paracetamol. What we decided to do, we decided to go for IV tramadol with IV paracetamol. We even decided we diluted in hundreds because we wanted a blind trial. So 100 cc of neomol and comparison with 100 cc में tramadol डाल दिया. So patient will also not know, you know, because it is the patients who will be answering, no, whether they are whatever pain relief. So when the time of thesis writing came, there were no studies, no, which were actually comparing IV tramadol with IV paracetamol. So I use this for that student. ठीक है. IV tramadol का भी कोई मिला तो भी चलेगा. IV paracetamol के तो बहुत मिलेंगे. Then somehow we did find some of the studies which were of IV tramadol. Okay, but they were not in comparison with IV paracetamol. Okay, but we use that. Their results, what is the intensity of pain relief in them, and we compare that with our IV tramadol. Understood? And when there were studies with IM and IV paracetamol, we made a conclusion that see, I will not go into detail, but there is a way of interpreting why the results are different depending upon the rules of administration. So it's not like that you have to go and find exactly your thesis title to them. In fact, the fun is when you are not matching with them and you try to analyze why it is different. So, or why the difference in their methodology and my methodology, whether it has affected the conclusion. Are you getting? The fun is there in that. Okay, so their route of administration was different. My route of administration was different. That's why I had more better analgesia, but more side effects of nausea and vomiting with tramadol. So there was fun in that, no? And second is not. When you particularly want to exclude something, okay, I want to have studies of prolapse, but none of them should be about the nulliparous prolapse. Unnecessarily, it will increase my search results. Okay, so there in that case, you can put the word not. So you understood this much. So while putting your words, you can use 3 words like this in capital in between them, and it will help you to decrease your search. It will become more specific. So beyond Boolean logic, there are field searching, control vocabulary, and specific features. Out of which I will say that you concentrate only on field searching. There's I don't think itna we are into the research that we need all of this. Okay, I think this is for the tertiary sources, to extract so much of it. But we are done. We are okay with field searching. So you understood the Boolean logic in searching. Okay. Now you go for this field searching. So what is this field search? Now, as I already told you, you go in a library and you don't know the book. You have not decided which book, but you know the author. Yeah, I want to read this particular author's book. Okay. Or sometimes you know the title, but you don't know the author. Like somebody said, yeah, I had read this book, but I don't. So there are various ways should be searching, should be there. No? Now, if I go to this and I say the author's name, let's say I want to read Shakespeare. Now, let us say the librarian doesn't know Shakespeare. Okay. Those people who have not read, they also know it. Okay. But let us say that person doesn't know. Shouldn't be there in the library as a attending, but should. So she will not know whether you're talking about the book, title of the book, or whether you're talking about the author. Right? Unless you specifically mention that I want to study or I want to read this particular author's book. Are you getting? So this is field searching. What do you mean by that? That all the database will be provide you some ability to search in this. So it allows faster searching. If you tell them I want Shakespeare, which is author, then she will directly go in that section, right? If you don't specify that it is an author's name, then she will not understand anything. She will be searching everywhere. So what is that? I would like to find an article by John Smith. Okay. So if I put John Smith in this search box, okay, right? Now the database doesn't know who you want that word in the title. Is that your population name? Is that the disease you are searching? Is that the intervention you are searching? Or is it an author's name? Or is it a journal's name? What is it? Are you getting? To make it specific that this is an author's name I'm searching. Like you may be doing a study and you know that this particular person has worked a lot in this. Let us say new surgical outcome or new drug you are studying or new technique you are studying. And this particular person has been practicing this technique. So I want that person's articles. Okay. So you put that person's name to that. You must have done a hell lot of work, no? So how will you specify it? So this is it. You want to search for article by John Smith. If you put it in simple search, so it will think John Smith can be anything. It can be title name, it can be journal name, it can be anything. But if you put in author's field, then it will know, okay, you are searching for somebody who has written this article with this name. Okay. Then same, you search all the field. I want it is to be published in 1997. I remember that much. Okay, if you put it in a search box, there might be a study which has a title, a study of 1997 patients included. I suppose the title right also that will also come. Are you getting? So here you are writing publication field at 1997. How it is that I will show you. So formats in different databases have different ways of allowing you field searching. Some of them have drop down menu. Okay, jo tum log abhi tak, I think you must have used it for many reasons. Other people don't have drop down menus, so they use tags or labels. What are these? The AU is for author, TI is for title, then DP is for date of publication. Okay, what does that mean? That if I had to write, see, it's not visible. They are written Jonas. Okay, then in the square bracket I have written AU. Okay, and then I have put an and because I don't want anything nonsense. And then I have put in publication date, and then in the square bracket I have written DP. Okay, so now the database knows this is the author's name, this is the year of publication, and I want and is put on. So I don't want anybody of else's chance publication. I want this year, so I got an immediately get an article. Understood? So with this, you made it easy for them about how to search. So this is field searching. So this you should know. See, this is drop down menu. So, and here is the Boolean logic. So what the first you drop down, there are a lot of things: topic, title, author, game author, then publication name, year, and all that. So you see, I'm first talking about the title. So here you put some of the words from your title. Okay. Then you go for the second drop down. Again, same thing will appear. Then you say author name. Okay. And you put author's name over here, right? So you know that this particular work mein ye author ne kya kiya hai, that I want. You then add as many fields as possible. In most of them, 4 or 5 fields is enough. You can put an publication date, you put a journal or something like that. Understood? So there is a drop down menu over there. So you can select what you are writing over here will be, if it is an author's name, you select author name over here. Understood? Instead of putting in tag. If you are writing a publication date over here, you put in publication date over here. So they know this is what you are searching. This number corresponds to the date of publication. So this way it will help. So it's not visible actually. So PubMed has this way. Okay. This is PubMed's field searching. Advanced search, if you click no, you will go to PubMed search. Like what the first time I show you, this is just a routine search. Okay. But you are smarter. So you go for advanced search. You come to this field searching. And then see, first I put the name and author. Okay. And I put an author name over here. No, author name. Okay. Then second, I put an publication date. And I written publication date. I have written. Okay. And I search for it. So I immediately get that author has published 5 papers in that year. I got all the 5. Understood? So that is field searching. So you can go for a particular author. Okay, you can go for a particular topic. You can go for a particular journal also. That I want something which is published in this journal only, related to this topic. Understood? Now control. I will just skip it because I don't think you all will need or understand. Now let us come to what are the common problems that you will find. First is too many references. 10,000, 2,000 is also not less. Sometimes 1 lakh, 2 lakh references will come. How will you search what? So what is the reason? You are using a very broad search term. You're using hypertension. If your study contains pulmonary hypertension, use that specific. I told you, you have to find your PICO. What specifically you want? That day, that way, like it was not all elderly patients. Elderly patients with decubitus ulcer. That was your specification, no? Like I was studying prediction of preeclampsia in primary gravidas. Not all pregnant women I am studying. So why I will put something like that? Are you getting? So be very specific. So instead of putting hypertension, put pulmonary hypertension. If that is what. Then try to use Boolean logic. So you are putting only bronchodilator, but what you are studying actually you are studying bronchodilator, effect of bronchodilator on asthma patients, right? So both it's a comparison. Use both the words, right? P and I and C and O. That's why you need those words, right? And put an and in it. So it will only come if their studies are related to these 2 things. Otherwise, rest of things won't come. And filters not used. So it becomes filters make the search more focused. How is that? I will tell you within the next 10 minutes. Okay. So let us say. So we are putting only hypertension in the PubMed. See, almost 4 lakh reference research results are coming. 4 lakh. And you're putting just pulmonary hypertension. I just added one thing. I have not even added Boolean logic or nothing like that. I have not made it more. I have not done field searching, nothing. But still making one additional word, I will drop down into 45,000. So use specific words, right? Then when you're putting only bronchial dilator, there are 230,000 references. You put Boolean logic and what you want to study comes down to 20,000. Understood? Then use of filters to make it more specific. So while your research results are coming over here, this is your search window. I already showed you this, right? Here you will find on the left side the filters which are there used in PubMed. So how to use them? So these are the filters. Can you see it? So first is article type, which is the clinical trial review or more. So a lot of case abstracts, case studies, and all that will come. Text availability, abstract, free, full text, text. PubMed comments, readers comment. Then publication you want within last 5 years, you want 10 years. You can even customize range. 2001 to 2010 ka chahiye. Okay, understood? And you can even say species. Yeah, you will find a lot of this has happened to me. One of my residents had actually got next. I gave the topic next day. They got me 10. All of them were done in some rabbits and something. I'm like, didn't you even read it? Because they used to just see the title and they bring it. I was like, at least see what is the population. They were done in animals. So you can just, and that will come in the results. No, it's not the mistake of the database. You have put the words are right. And that study was done in an animal. A lot of pharmacology people are studying drugs in animals. No, right? So if you want to study calcium channel blockers and hypertension, that study must have been done on an animal also. So that will also come. So you can just put it as a human trial, So whatever studies will come, they will be related to humans and not with the animals. So these are the filters. There are some additional filters, which I don't think which you will be using. Okay, so see. So Once you use the filters, it can drop down to 4876. Okay. So what filters I have used? I have said I don't want review article. I want clinical trials. I want original documents, because that you will be using. No, you know now you are supposed to use compare it with the original articles, not with textbook material. You can't say that Datta has written or this particular textbook of my Das has written this. So that's no, you can't. Das can do whatever they want. It has to be always original article. It always has to be the clinical trial to which your study will be compared in the thesis. So I just mark clinical trials. So just put something which is only clinical trial. Don't put reviews. Don't put anything else. Okay. Then I will like, I mark humans. Make it sure that it is done on the humans. Okay. Then I am at the language. So many articles will appear in different languages also. Okay. So all of this, and I wanted to study asthma in children. So I have written age less than 18. You know, study population का age less than 18 होना चाहिए, because that is my population, pediatric का study है. So it dropped down to 4,800. So you have to know how to use the filters. Understood this much? Now what is the other problem? Too few. Like you are trying to search for it, but you are not getting as many references. So first, make sure that the filters that you activated previously are not still active. You know, deactivate them, so that it will broaden the range of the search. Understood? Then use this use of single term. You are using particular this, but there are many alternative words, na? The black water fever or malaria or hemolytic. You know? So all if you put or in that, so there may be studies which has this word, and it was disregarded. It was not coming in the research result because you are not used that word in your search. So try to use alternate results and try to add or in it. And do not use you did not use the mesh term. That means you know this is very rare. I feel that you are using a term which is not quite commonly used, and then a lot of publications are not using that term. So that's why that study is not coming. I don't think, I feel in India, though, at least we are using all the scientific terms proper correctly. But maybe in some other countries, that who uses Visham Jwari? I don't feel you all know Visham Jwari typhoid. You know, we are all studying in. I think. I don't think that will be the problem, but sometimes you do find that whatever word is used for by you is far too local. You know, that not of international publications will have used that word. Then you change that word. Okay. See, so if you only black water fever, only 200 references were coming. But if you put hemolytic and malaria, you know, that means why these two words? Because in malaria you don't want to study anything which hemolysis you want to study. So that study, they are rising to 609. Okay. Then you use instead of Visham Jwari, there is nothing is coming. This is a local word, no? Are you telling? Are you getting this? It's a local word, but you put in typhoid, then millions of references will come because a lot of studies are there. Then how to find for the recent references? That is one thing that all of your abstract, the synopsis will be submitting. They will be telling you that most of them should be within last 10 years. Some of them from 20, 1 or 2 can be there for a historical. This is first this drug was studied. 78 ka reference. That is 1-2 references are okay, but not all of them can be from 90s. Now that we are in 2022, so all of them should be after 2000 only. So how to go for the recent references? I already told you there is a filter over here, right? So go for the filter. So you can put a customized date range also, whatever, and you can say past 5 years, past 10 years, and they will show you references in that range. Then single citation you won't do. This is very important. Full text and free. You will actually start searching the references now, so you'll understand once you start searching that you think that you have more than 100 references. Okay, but every time you click on them, it will be only the abstract and full text will not be available. And for you, it is okay right now, you know, because you are not done the study. Are you getting? And you will not even download it because for you, it is for synopsis. Because today's generation is like, as and what it is needed, the work will be done. We don't foresee into the future a lot, right? Okay, Sara, that is this. Jo hoga dekha jayega. So, but what will happen? So you will have this plenty of good references, you know, in your list. When I will write thesis after 3 years, I have all these 100 references with me. And after 3 years, when you open them, 2 years, everything is abstract. Everything is abstract. I'm like, oh my God, I was so stupid. Why did I only downloaded abstract? You know, or some of them you won't even download. I'm like, I know one was there which actually like mine, but I don't remember the name of that So don't do that. So first you have to go for the full text. That is very, very important. Not for the synopsis, for your thesis. Why? Because full text will have methodology, full text will have results and discussion. Understood? And you will be comparing your results with their results. So if you are downloaded only abstract, what will you do when you write thesis? Understood? So try to get as many. So you can even, in the filters, you can get text availability, abstract, free full text, and full text. So go always for the full text. Okay? Free है कि नहीं उसका हम लोग आगे देखेंगे. Free मिला तो immediately download, because sometimes an article stays free for a very small period of time and then later it becomes paid. That has also happened with me also, because I thought once it has become free, that means it has passed that primitive years of being paid for. Now it is freely available. But the opposite has happened, that first it was free, now it has to be paid. So don't do that. Once it is free, immediately download. How you will use it, you may not even use it, but download it. Understood? So when your research results will come, all this, so just at the end of it, in the red letter or in the pink letter, it will be written abstract / free text / this only full text. So whatever it is, you can, if it is free, immediately download. Nahi hai to I will tell you one thing. Okay, so once it is available, full text and free, how to download? Spend 1 minute on that site page and find out where these options are given. Options will be HTML, print PDF, and what printer friendly, something like that, and PDF. Okay, what is you people are habituated, once it is there on the screen, you will do control save and you'll save the web page, right? Isn't that the habit? Don't do that. Spend some time on the, it is somewhere. Every site will have different site to give. Sometimes it is just at the title के नीचे आगे ही रहता है, कभी-कभी ऐसे side में रहता है, कभी-कभी यहाँ पे रहता है, कभी-कभी नीचे रहता है. Some or and always download PDF. Why? When you download HTML or a web page and you open it afterwards, you research tables and graphs will not be there, which is the essence of what you need. Are you getting what I'm saying? Only the material, or what are you going to do with it? You want tables, no? Because you have to make your own tables. उनके 2 रहेंगे तो तुम्हारे 20 बनेंगे, right? So always download in PDF only. Okay. Now this is the last slide of mine. Do not brag about it. If you want to find a really recent article and it is paid on Pubmed, do not tell other students कि madam ने हमको ये बताया. Like I made this presentation last year, so it is of last year, but for that time it was absolutely recent. Yeah, the date on it, see, it is talk, it is an obstetric journal, very reputed European journal. You have to pay for, even if it is 20 years old, no, unless and until somebody has bought it and put it on their site, like so many blogs of OBGYN that we are part of, it is not available. If you go in their site and you go now, it is always paid. It's such an essential material of OBGYN, very good. Actually, it is good. So you all must be having some, this is something. The talk is the best journal of OBGYN. Best. Same way you must be having. It is not only for the research, it is also my practice. Also, I use it. New things come, I go and what talk says. Are you getting? Same way. So last year I made it. So this has, the use of urethral bulking agents in the treatment of stress urinary incontinence. They have done a study on it. And not study, it's more or like a review also, like a meta-analysis. They take into consideration a lot of this. And it was published on 20 January 2020. First published, and the talk volume was April 2020. Okay, so in April 2022, this has come up, and I made it. 2020, last year, no. So it was around this time. It was not available. Okay, so what I did this. How many of you are aware of this? No one. There is a site called SciHub. Okay, Go on that side. Put the title. Okay. I have been really lucky enough with this. I immediately get an article for PDF download, full text. It's not only abstract or something, you know, just to tease you by. It's a full text PDF download, then download it actually and save it. Okay. So this is one thing. So I hope with this you'll be able to search some good references. Okay. And not only for this, but thereafter it will help you in your studies also. I told you, I still do it. I still read talk, and how to find it I should know, na? Or something new controversial comes, I should know what is there. So I hope this lecture will help you. Thank you very much for patiently listening.
Thank you, madam. Now for next lecture, I call Dr. Sureka Jadhav, madam, Professor Anatomy. Madam will talk on how to write original research paper, which is again important. It is one of the important criteria while filling your exam form. Okay. Welcome, madam.
So good morning, everyone. Should we start? Yes or no? Okay. Since 2 days you are listening about everything about the research. Okay. So now you are going to submit your synopsis first. Then you are going to write your thesis. And what you will do afterward? What you are going to do after? Anything else? Don't want to present paper? The paper is vertically writing. Yes or no? Are you selecting your topic? Yes or no? Not something. No, why not? Then you have to submit your date must be there, no? Or submitting your stuff. Yes or no? I think there must be date. No? Okay. So, there is some article for the manuscript. It's the last step of your research. Okay. For that, you have to do lot of work, and for that you need this. before you start, always keep in mind that your published paper as a permanent record of your research and your passport to your community. So whenever you are publishing paper, it is a passport for your community. It may be gynecology, it may be psychiatry, it may be anything stream. Okay? चला बोले हो रहे हैं वरचं आर्टिकल दिसत नाही. Why we publish the paper? Why you are going to publish the paper? आणि तरी कारण असतील share the information from it. Share the information. Anything else? From that side? You don't want degree? Don't publish in paper, you cannot get the form. That is mandatory. So there are so many things. ते नाही रे वरचं जे हेडिंग आहे ना ते दिसलं पाहिजे ना आणि इथंच थांब ते प्रत्येक वेळेस असं काय केलं ते खाली घ्यावं लागेल. खाली घेतलं. So, reasons for the publishing. Ideally, it should be to share the research finding and new discoveries in the science to improve the knowledge, quality of life, and provide the better healthcare. But there are some personal reasons. Practically, to get the promotion, to enhance the career prospects, to get the funding for the degree, for the knowledge sharing and the achievement, and to improve the scientific impact of the institute. Now, this last one is very important for the institute nowadays. For the NAC, they are forcing you, publish your paper, publish your paper. So you must able to write down at least 2 papers before you appear for the MD or MS examination. Okay. However, editors, reviewers, etc. will not consider these reasons when assessing your work. They will not consider whether this person is appearing for the MD or his institute is going for the NAC. So let accept his paper. No, they will not accept your paper. What are the types of journal papers? कौन से होते हैं? Different types of paper. मैडम ने 2-3 बोले. मैडम पढ़ा रही थी तब तो मैडम ने बताया different है. Anything else from that side? What are the different types of paper? Original research article, then reviewer article again. Yes. So there are many different types of papers. Original research article, review articles, case reports are there, clinical case studies are there, clinical trials are there, then book review, short communications, conference proceedings, open articles, technical papers, letters and communication, and data papers. So these are the different types of journal papers. But for you people, original research article is very important. Okay. What is the original research article? What do you understood? Yes. It is a type of academic writing that provides in-depth analysis, interpretation of a single topic. Though you are doing the thesis, you will take one topic and you will publish your paper on that. Okay. It is based on empirical evidence. It proposed new theory and shed a new light on an already explored topic. It used the statistical data and pre-existing research along with the strict code of citation. Okay, so this is called the original research article. Research papers are a bedrock of modern science. It is the most effective way to share the information across a wide network. Basic triad to write an original article successfully are: a subject which should be worth reporting must be an addition to existing knowledge. Knowledge of the basic structure of an article. You must know what is the structure of the basic article. And it consists of title, page, an abstract, keywords, etc. We will see in detail about it. Then knowledge of the essentials of good writing. Okay. So these are the basic triads of writing. Basic steps for writing research article are before starting the research and after completion of the research. Before starting the research, choose the right research question or objective or the hypothesis. Research question must be clear, precise, and focused. Do the literature search. Just now, madam told you about the literature search. That is very important to identify the current problems, to find out the research gap which is present there, and discuss with your colleagues, with your guide and the HOD, and then decide what to do. After completion of the research, there are two steps. Structure the research article. It is widespread adaptation of the IMRAD structure and the TACAR structure. Format your article according to your chosen journal. Whatever you want to publish, you must decide in which journal you have to send it. So according to that, you have to check the author's guideline and you have to prepare your article. Okay. Coming to the general structure of the research article: title, abstract, keywords. Make them easy for indexing and searching. Okay. And they must be informative, attractive, and effective. Main text, which consists of introduction, methods, results, and the discussion. Then conclusion, acknowledgement, references, and any supplementary data which is there. Okay. So this is the general structure of the research article. Anyone have published in the UG's career? Yes, you have published. Okay. Then you must be knowing in which journal. Then how to start a research paper. Choose a topic which interests and challenges you. Okay. Focus on limited aspect. Most important thing is select a subject that you can manage. It should not be too vast, or it may not, it must be in your boundaries. Okay. Avoid subjects that are very technical and specialized. Do not go for the controversial topic. Okay. Initially, at least. How to start writing an article. Bradford Hill questionnaire will help you to think analytically while writing the IMRAD. Introduction. Why did they start? Then material and methods, what did they do? Results, what did they find? And discussion, what do the result means? So in this way, you have to start with your article. Sections of the manuscript of the article. I am giving you the common format of the basic structure of an article, but according to journal, it is variable. Okay. First title page is there. Then most of the journal, they think about the second title page, then an abstract and keywords, introduction, material methods, results, discussion, summary or conclusion, acknowledgement, references, tables, graphs, figures, and legends to the figure. The first title page, it consists of title of the article, list of the author with or without degree, designation and institution. Then the required thing is running title and the keywords. Then the fourth one is a word count, number of tables and figures. And the fifth one is details of the corresponding author, which is very important because this corresponding author takes the follow of your article. Whether it is rejected or any correction is required, okay, or anything is lacking, they may send you email or and for the inquiry. So corresponding author must be able to track the track your article or the manuscript. Okay. Title. It is the first thing which everyone reads and catches the reader's eyes. It should be concise, descriptive, clear, and must contain the keywords which are important in literature searching. And it should be reassessed frequently. So now you are searching for the topic for your thesis. Yes or no? Have you started the searching? Okay, how you have started? How you decided? Can you do thesis on this topic? Yes. Anyone? Yes, have you started or not? Searching for topic. Then how you are searching?
I'm looking for heading or topics which I'm interested in, or I think I can be able to do it. Right. We have just started. Pediatrics. So I am more interested towards neonatology. So I will be looking in topics which are related to neonates. And I am searching for topics that I will be able to research on. So they're not looking for common disease, not a rare one. And some disease which needs research. I have not decided yet.
गाइड में गाइडलाइन नोट करें, गाइड में कई इंस्ट्रक्शंस दिए आते हैं, हाँ?
My topic is thyroid dysfunction diabetes. Srivastava.
Title is very important while searching the literature or while writing the manuscript. Okay. Because you are going to read the title, no? It should be, so while writing the title, it should be concise, descriptive, and clear. And it must contain the keywords, okay? And you should assess it frequently. Then coming to the authorship criteria. The person have contributed significant ideas and experimental design to the project. They are the authors, okay? Who have taken part in the data collection analysis, participated in writing. They are also the author. Each author should see the final version of the manuscript and give the consent to the co-author. When there are multiple authors with various contributions, that time the first author is the one who has done most of work, but here the advantage should be given to the junior author. So the junior is first and then the senior. Thesis is the personal project. Therefore, the papers derived from it. Naturally, the name of the candidate should be the first. So now you are deriving your papers from the thesis. So your name should be the first name as an author. Then your guide and etc. will come. Okay. Take care while writing the name of the author and use only one name with the same spelling for the family, initial and the middle names in all publications. Remember, when you start publishing your papers, your name should be and your spelling should be correct, which you want to appear in the paper. And in the second paper, third paper, or 50 paper, you can write same name. So it becomes easy for the database to find out your name, okay? Which will help in retrieving author publications from the Medline database easily in one pass. After that, after publishing or after finishing your MD, you will attach somewhere and you will start doing the research work. That time you will realize the name is very important, because in the database, if you give the different names, different things will appear. It will not give all the publication in one click. So use the same name whenever you publish your article. Okay. Then in the second title page there is only title is there, and this title second title page is usually used for the review process. Okay. This is important to avoid the bias by the referee. So only in the second title page, there is only the title's name of the title is there, no author's name or the institute name, to avoid the bias. Then abstract. Abstract is the summary of your research article, and it is between 150 to 300 words. Again, it is variable according to the each journal guidelines. Okay. It tells the reader what you did and the important finding. It should be self-explanatory without abbreviation and the references. You should not write any reference or abbreviation in the abstract. That is the important thing. Keywords after the abstract. When you finish the abstract, write down the keywords. Use the mesh terminology from Index Medicus or the Pubmed for choice of words. Okay. Very critical part to write. So write, rewrite until it becomes flawless. Abstract is very important because it is the mirror of your article. Okay. You should write it in the last so that it accurately reflects the content of the paper. Though it is the first thing, you should write the abstract in the last. When you finish your introduction, material methods, results, discussion, and conclusion. Okay. Then coming to the keywords. In an electronic world, keywords determine whether your article is found or not. Avoid using too general terminologies or too narrow terminology. Okay. What is IMRAD structure and TAKAR structure? IMRAD is the main text which consists of introduction, methods, results, and discussion. TAKAR structure consists of title, abstract, keywords, acknowledgement, and the references. Title, abstract, and keyword make them easy for indexing and searching the article. Main text of an article or the manuscript consists of most important part of the paper. Introduction is the most important part of your paper because it sets the tone and the quality of the entire paper. Remember, it must be brief, easy to read, and to the point. It should not be too long. It must be brief and easy to read. The reasons why study is undertaken with it rationally must be the core part of the article. So, in the introduction, it must be short, concise, and you must tell why you started or you have taken this study for the research. And you must show the what is the knowledge gap is there and you are working on that. Okay. Then you can write down the aim and all these things there. Discuss the background of the research project to outline the problems, existing gap in the knowledge. You can divide it into 3 paragraphs. In the first paragraph, you can write few lines about the topic of the paper. Then in the middle paragraph, you can do the literature search. But it should be limited. You should not write down the literature search like a thesis. Okay. Then final paragraph, justification roadmap, where you can show the gap in the knowledge and what you are going to do or what you did. Okay. Then coming to the material and methods. Organize this section in chronological order with logical sequence. Start with the material, continue with the protocol as they were used, and end with the data analysis. Give enough details to readers so that they can repeat it. Okay. Explain new methodology in detail, otherwise name the method with reference. If you are using new methodology, then give in details about everything. Which instrument you have used, what you did, what was the sample size, everything you should write down. Include the inclusion and the exclusion criteria. Then introduction to control group, placebo, randomization, etc. are to be mentioned. Then write down about the statistical methods which you used. The next important thing is institutional ethical clearance. That is mandatory, and nowadays they require the ethical clearance certificate before you submit your article or along with your article. Okay. Ethical consideration of the ethical committee. It includes any required informed consent, funding source, a conflict of interest statement, a statement about the compliance with the declaration of felicity for animal studies if it is applicable. So you have to fulfill all these ethical considerations. Results, which is the heart of your paper. It contains 2 parts, the presentation of data and a statistical analysis. Figures, tables, or graphs are the most effective way to present the results. Captions and legends must be detailed enough to make them self-explanatory. One picture is worth 1,000 words. So photography is very important, and your tables are also very important for your paper. Statistical analysis. It is used to obtain the objective proof. In comparative studies, each comparison should be provided with a specific statistical evaluation. Results of the study can be positive, supporting the existing hypothesis, or it may be negative. Negative results are as important as positive, so don't hesitate to publish them. If you get the negative results, don't hesitate to publish. Write down whatever you got, okay? Coming to the discussion, it consists of 5 basic parts. An introduction to the discussion. Start with the short paragraph summarizing the important findings from the results. So you will summarize your results very shortly, and you can start with the discussion. Discussion of the results. Discuss each obtained result adequately and compared with the similar previous results. And as madam told you that there must be some Indian population study must be there, so that you can compare your results with the Indian population, okay? New findings provided by you. Then limitations of the study. What limitations you got? Any recommendation relevant to the practice? Then coming to the conclusion, it is a take-home message. It could be written as a separate section or as the last paragraph of a discussion. In some journals, it is a separate paragraph, and if it is not there, you can write down after finishing your discussion. In this section, stress the most relevant findings of the study and justify and explain the conclusion of your study. Acknowledgement. Acknowledge those who have helped you at any stage of your research. Also remember to thank the funding agency. If you got the funding agency, then you can thank them. What is referencing? Referencing is a standardized way to acknowledge the source of information and ideas that you have used. And that's why you must use the references and you must cite the references properly. Details of the references will be told, and commonly used referencing styles are the Vancouver method and the Harvard referencing style. Okay. Tables, graphs, and figures. Prepare the figures, graphs, and tables in a professional manner. Give the tables and figures where needed. You must cite your table and figures in your results and even during the discussion. Figure number 4, table number 2. Like that, you can compare, you can cite your table and the figures. Appropriate numbering of figures and tables mentioned in the text. Legends of the figure. Final step is revision and the proofreading. Revision, revision, and revision. Once you have written, you have to go through it 3-4 times. After writing the first draft, at least a dozen revisions are usually needed to improve. Make sure that all authors read the first draft, give them timeline. Tell them that complete the reading and give within 2 days or 1 day. Okay. Revision and proofreading. Proofreading, all authors should participate in the proofreading. Check out the grammar, spelling errors, punctuation, and check the references again. Now there are various sites. Once you go there and put your manuscript, they will do everything. And you are knowing more than us what you have to do. Responsibilities of the author from the preparation to submission. Article must be checked by all listed authors. Ethical permission is there or not. Don't give the gift authorship. Your title, abstract, and keywords should be easy, informative, attractive, and effective. Avoid duplication, duplicate publication, and data alteration. Obtain copyright permission if figure tables need to be produced. Make your article concise. Don't write too long and too short articles. Tips. First, to start with your tables and figures. When you start your work, you know the methodology, how you are going to do. Then you get the results. Okay. Then you make the tables and simultaneously you are taking the figures or photographs. They will tell your story to you. Start writing your method and results. First, you will write the method and results. Once you started, when you are writing first time, then it becomes very difficult. If you start with the introduction of that, so start with the methodology because you know what you are to keep or you. So write down the methodology, then results if you obtain, and simultaneously the figure or the photograph you have obtained. Okay. Then, so you will start with the methodology, then results, followed by the introduction, discussion, and lastly, abstract. Reassess title of your paper. Support every statement with the reference. Each and every statement from your manuscript should have reference. Okay. Concise, it should be concise, to the point, free from the grammatical errors, and technically should be correct. So the process of writing, it will start from your data, that is figures, tables, then methodology, results, discussion, introduction, conclusion, and the last thing, that is the abstract. And you can assess your title also for the paper. Thank you. Any difficulty or any question? Not difficulty, any question?
Thank you, madam. Okay. So all of you are exhausted. Not only today, but I think for 3 days you must have been exhausted a lot, right? So what is the plan today evening? Can I see some movie? Anyone for the movie? Yes, which one? कौन सा? बताओ ना थोड़ा. Which one is the recent one? किसी ने देखा है recently, so that we can like plan. हाँ? Anyone who has seen some recent movie? कोई movie नहीं देखा recently? कोई series? ना वो movie तो कोई देखता नहीं. Now it's time. It's like OTT. Huh? Which one? Before joining KGF. KGF तो देखा होगा सबने. किसने देखा? क्यों देखा? तो ऐसे नहीं ना कि हम कोई भी मूवी, सब मूवी तो नहीं देखते, या ओटीटी पे जितने भी व्हाट यू कॉल सीरीज या व्हाट एवर इट इज, वन वाज गुड तो देखा। तो ऐसा तो नहीं होता है ना कि लाइक वी सी ऑल द मूवीज विच आर रिलीज, ओके, इतना तो नहीं है ना। हम डिसाइड करते हैं कि कौन सा मूवी देखना है नहीं देखना है, इस बेसिस पे। IMDb. Now this what is called as IMDb. What is that? Long form क्या? Internet movie database. So वो रेटिंग्स देखते हैं, राइट? उसके पहले बिफोर दिस IMDb there used to be star ratings out of 5, राइट? और वो मूवी रिव्यू भी आते थे न्यूज़पेपर में, या हैव यू रेड इन मूवी रिव्यू सम टाइम बिफोर? क्या होता है उस मूवी रिव्यू में? लाइक have you ever read any movie review on in the newspaper, or like even some app like Bookmash also, they also give some movie review? क्या होता क्या है उसमें, right? Likes and dislikes, but like some there are movie experts who write the review. वो क्या लिखते हैं? Critics. They only criticize. Then अभी अगर कोई मूवी रिव्यू होता है तो लाइक एट द स्टार्ट वो ये बताते कि स्टोरी क्या है, लाइक व्हाट इज द स्टोरी, उसके बाद वो अपना रिव्यू बताते हैं, है ना? ऐसा ही होता है जनरली, व्हाट इज द स्टोरी लाइन, देन दे गिव लाइक देयर रिव्यू की हाउ इज द एक्टिंग, हाउ इज द डायरेक्शन, हाउ इज द एडिटिंग, हाउ इज द म्यूजिक, एंड देन they at the end they say कि like why you should watch the movie, why you should not watch the movie, right? And at the end rating. Based on that we decide generally, unless like it's a movie of you are diehard fan of that actor or actress, where whatever the movie or whatever the storyline may be, we have to watch the movie. है ना? So that is like a movie review ऐसे होता है, based on that we decide कि whether we should go and watch the movie or not, right? अभी यही हमें करना है, रिव्यू करना है। लेकिन यहाँ रिव्यू मूवी का नहीं करना है, we have to review a journal article here, okay? So here, like it's a simple thing, like you have read the movie review, here we have to review the journal article, we have to critically evaluate the journal article, okay? So there are two purposes why we need to critically evaluate this journal article. One, like you are like in the phase of synopsis. Now 2 lectures were already there on the journal articles, okay? So most of the things are covered here, just like a revision you can say, or for some other purpose, like when there are 2 things, like you are now doing literature search for your thesis topic, right? So you have to select the articles which can be reference articles for your thesis or dissertation. That is one thing. Second thing is like most of the times I think most of the departments, they have this PG activity where there is journal club. Journal club activity होती है, कुछ हुई है एक दो? So in that journal club activity also, where you have to select one journal article and you have to critically evaluate that article, and when like teachers and other your colleagues, they will discuss about that journal article. Okay, so for this two purpose, you need some guidelines like how to critically evaluate this journal article. So we'll in this session we are going to see what is critical evaluation of journal article, what are the guidelines, and how to write a summary. जैसे हम movie review पढ़ते हैं, like that you have to write the summary of your observations. Okay, so this is what we are going to see. Like a movie review, we are going to review a journal article. Okay, listen carefully because we are having an activity on this session. Okay, you have to, I will give you one journal article to each group and you have to critically evaluate that article. Okay, now what happens most of the times, like certain terms which are used synonymously, like evaluation, then judgment, then criticism, then analysis. Okay, these are the terms which are used most of the time synonymously, like analysis or criticism or evaluation or judgment. But though like more or less they are same, but there are minute differences. Okay, we'll first see what these terms mean. So what is evaluation? Evaluation is assessing the strengths, weaknesses, and the validity of the article. Okay, so what are the good points about that article? That is strength. What are the negative points? That means what are the weaknesses, and whether the article is valid or not. Okay, so you have to look after all these things. That is evaluation of the journal article. Okay, then we have to inform the readers. Okay, like the summary, like movie review, they inform the others. So to inform the readers about the article's value, how good is the article, by describing, explaining, interpretation of that article and analyzing it. Okay, so by your overall review, you have to present to the readers so that reader can make the judgment about the article, like you make the judgment about the movie. Okay, by reading the review. Likewise, you have to summarize the article, you have to give your review and give your judgment about the article so that other people can decide whether that article can be cited or not. Okay, now what do you mean by critical, or what do you mean by criticize? Like when you criticize something, what does that mean? Pointing out the negative points. Yes, mostly criticism, जब हम बोलते हैं you are criticizing someone, most of the times it is taken in a negative manner only, but it is not like that. Criticizing is not always in a negative manner. To be critical means not to criticize only in a negative manner, but you should question the information which is given, okay, and the opinions, and present your evaluation. Okay, it's not like just you have to like point out some negative things. Okay, you have to question what is given there and present your evaluation. Okay, not necessarily it will always be in a negative manner. Remember this, criticism is not always in a negative manner. Okay, and for that we have to understand, if you want to criticize any article, you have to understand that topic from different perspectives, why that article was written, what are the context. So read related text for that to understand what are the different angles can be there for that article, and in relation to the theories, approaches, framework, why they have why that methodology was selected, why they have framed the article in a particular way. So you have to understand that article from the different perspectives, and then you have to criticize. Okay, if you look for only from one angle, then it becomes difficult, then you will only find the negative points in that. Okay, that's why you have to be careful while criticizing. So not only when criticizing, not only point out only the negative points. Okay, now what do you mean by evaluation or judgment? Evaluation, as I told you, strength and weaknesses, and it is based on specific criteria. Okay, when you evaluate something, there has to be a guideline, there has to be most of the times a checklist is given. Okay, you have to see whether this is present, yes, no, or give the rating on a scale of 1 to 10 or something like that. So evaluation is based on a specific criteria. Okay, you have been given a checklist or some criteria is being given, and then you have to evaluate that article. While judgment is mostly the personal opinions. Okay, overall, what is my opinion about that article? So that is judgment. So evaluating, it requires understanding of the content, but understanding the purpose, who is the intended audience, and why it is structured in that particular way. Like say, for example, I have to take a lecture on hand washing. Okay, importance of hand washing, that is the topic of my lecture. I have to take this lecture. Now I have to take this lecture for say MBBS students. Okay, one session I have to take for the nursing staff in the hospital, one session I have to take for the class 4 workers in the hospital. Will the same matter will work for everyone? No, like, right? Because for MBBS students, I am going to tell them like which microorganisms will be transmitted, which infections will be there. If I tell the same thing to class 4 workers, they are not going to understand. Okay, again the language will be different. For MBBS students, I will speak in English. For class 4 workers, it won't work if I speak in English. In local language, in the language in which they understand, that I have to tell. So as the audience topic is the same, right? Importance of hand washing, it is required for all these different cadres, but the content will differ, the language of communication will differ, right? That's why you have to understand that article from different perspectives, from different angles, like why they have structured in that particular way, and then you have to give your judgment. Okay, then what is analysis? Analysis means, like say in article, first part is what they have done, what information that they have collected, what is their data. Okay, that is called as content. Okay, till results points, what is the result? That is their content, what they have found out. The second part is the concept, which will be in the discussion section, like what new knowledge they have developed. Okay, what concept that they have developed, because research, when you are doing research, something new has to come up, right? So that is the meaning of the research. When you do the research, something new has to come up. So that is what new concept that they have developed. So there are two things. One is the content and second one is the concept. So you have to separate these two and you have to see whether they are correlated or not. Like content kuch aur hai and in concept they are saying something else. They should match. Obviously, whatever the content is there, based on that, what concept that they have developed. So you have to separate these two things and see how they are interrelated, how they are interconnected, and how they influence each other. So that is analysis. Okay. So though analysis, evaluation, judgment, criticism, almost the same, but there is slight difference. So analysis is separating the content and the concept, and then making sure how they are interrelated, how they are connected with each other. So that is analysis. Okay. So this is the basic terminologies that we are going to use: analysis, criticism, judgment, or evaluation. Okay. Now there is when you see any article, there is one rapid method where before we see the actual guidelines of critical evaluation, there is this rapid method of going through the article and decide whether that article is suitable. Like suppose for the journal club activity, you are selecting the article. So first you can quickly go through the article and decide whether this article is suitable for me or not. Okay, to present. So there are three phases. One is elimination phase, analysis phase, and confirmation phase. Okay, so quickly go through the article, read the title, abstract, look at the figures, tables, read the results, and see whether it is having any impact on the clinical practice, whether it is able to teach the analytical skills, whether it is in line with the current literature or the same old topic has been repeated again and again. Okay, something new is there or not. So first quickly go through this. This will be your elimination phase. If it is okay, then you can go for the, if it is qualifies, then it will go for the next stage, that is analysis phase, where you read the article in detail, you read the introduction, discussion, conclusions, everything you analyze. Okay, and the last phase is confirmation, where you give the scoring or the rating, that is evaluation. You do the evaluation based on the checklist. You can give the scoring on a scale of sometimes 0 to 10 or 0, 1, 2, something like that. Okay, so first you have to quickly go through the article, and then see whether that article is suitable for the activity that you are choosing or not. Okay, then starting with the guidelines for the critical evaluation. Okay, so this critical evaluation of any article, it starts with the bibliographic citation. So what does that mean? What does it include? Because before you present any article, okay, the other people, they are not aware of the article. So first you have to tell something about the article. So that is bibliographic citation. What does that mean? Yes. No, bibliography means references. That is okay. But when you are like in a journal club activity, you are presenting an article and you have to start. So first, like you have to give some basic information about the article. References, okay, references, the same thing, but here you have to give the reference of this article. So what all things are included in a reference? क्या क्या होता है references में? Yes, first part क्या होता है? Authors, right? Authors, so you have to tell bibliographic citation of that particular article means the authors, then title of the article, okay, then in which journal it is published, so name of the journal, then volume, issue of the journal, date of publication. Most of the time date is not there, exact date, month and year is there, okay. And then page numbers, okay, there are page numbers also. Remember, in the references, page numbers are also to be included. So this is the okay. So this is the one part. Then second, give the information about the author. Okay, whether the author has contributed something in the field of study or not. So what is his qualification? What is his authority? Okay, but it's not that someone who is qualified and someone like who has 100 articles to his credit only is a good article. Obviously, a new one who is presenting, who is publishing the article for the first time can also be a good article. But at least his background, like is he from the same field? Is he having the experience of working in that particular field? So give some biographical information about the author. That is the second part. Then intellectual plot line of the article. So like you can quickly go through the article and just say how the article is arranged. So that is intellectual plot line, or what are the subheadings of the article, whether it is introduction, then methodology, results, discussion, conclusion, references, likewise. What are the subheadings under which the article is organized? So that is the intellectual plot line of the article. Okay. So based on this, you have to ask 5 questions that are central to the research evaluation process. So first, you give all this information and then you ask the 5 questions. What do the researchers want to find out? Why is that important to investigate or understand? That means what is the research question or problem area? Why that problem area is important? How are the researchers investigating this? That means what is the methodology? Are their methods appropriate and adequate? Okay, whether the methodology is adequate and appropriate. What do they claim to have found out? Okay, what are the results? And what are the findings that they have, whether they are clearly stated or not? And how is this important in that particular field? Like how does this advance knowledge in the field? How well do the researchers place their findings within the context of ongoing scholarly inquiry about the topic? So you have to ask these questions, okay, when you read the article, and if you can find the answers to these questions quickly and easily. And the second point, can you trace the logic of investigation right from the opening paragraph till the end? There should be some logic right from the starting to the end, okay, and whether you can find answers to these questions. Okay, then you start with the evaluation of each and every heading. So first part of any article is what you read. Like if you are searching an article, so what you read first? Title, right? So in title should be appropriate and complete. Okay, that means what does the title lead you to expect in the study? You read the title, okay, Now, based on the title, what do you expect and whether that things are there in the article or not? So it should be appropriate and complete. It should mention the research topic, type of study, population, and geographic location. Remember, even if you are finalizing the title of your dissertation, you have to be sure that all these things are there or not, especially the type of study, in which population you are going to conduct the study, and the geographic location. Obviously, you cannot mention the exact location because some anonymity has to be maintained, because your dissertation will go for analysis to some expert teachers where you don't have to reveal your identity. So you can, in the thesis, you cannot mention exact the geographic location. Okay, but like if you are doing in Ahmednagar, you can say mid Maharashtra or something like that. Okay, but at least type of study and population should be there. Okay, remember, type of study, most of you don't mention the type of study in your research title, whether it is a cross-sectional, cohort, case control, experimental, whatever it is, you have to mention the type of study in your title. Okay, so when you read the title, you have to see whether the title and the research question, whether they are closely related or not, whether the title is objective in the tone. Okay, and if there are any special features, whether they are mentioned in the title or not. Okay, so in all sense, the title should be appropriate and complete. After the title, what is the second thing that you read when you are selecting any journal article? Okay, when you are searching, many titles will appear. So based on the title, you will select. So first thing, what you will read, whether you are searching that for your as a reference for your presentation or for the journal club activity, whatever it is. You will read the entire article in the first go. Then after the title, what will you read? Yes, abstract, right? Because that, as ma'am already told you, is the gist of the entire article. Okay, and at the first go, you will not read the entire article. Generally, 4 or 5 pages of article is there. So you will first read the abstract. So second is the abstract. So in the abstract, you have to look for whether there are backgrounds, methods, results, conclusions, along with the keywords. Just now you learn the importance of keywords. Okay, so all these things are mentioned there or not, whether the important 4 or 5 main features of the study mentioned are there or not, whether the results are stated appropriately in words, and whether the conclusions follow from the results, and is it as per the guidelines of the journal. Most of the times for the research article, the word limit is there. Mostly it is around 250 words. So abstract should be within 250 words. Okay, so and all other guidelines or whatever the headings that they are suggested for the abstract, like introduction, methodology, results, conclusion, and keywords. These are the only sections which are there for the abstract. So you have to look whether the abstract is within the guidelines of the particular journal or not. Most of the times, this is the stage where you accept or reject the article, right? What are the reasons for rejection of the article based on the abstract? Suppose you are like searching again for the references as a references for your thesis topic. Okay, you read the title, you think it's okay, let's read the abstract. You read the abstract and you think it's not okay. What may be the reason you reject that article? What could be the reasons? No? So all the articles which are published are good articles. Yes? Sorry? Okay, means it's not related to your like study area, study population. Okay. Inadequate references means based on the abstract only. You read the abstract and you reject it. So that study population is not belong to you. But like you can keep that article just for the comparison. sometimes like what happens is that the same topic is repeated again and again. Already you had 5-10 articles based on the same topic, means same results are there. That is one reason. Okay, so it is a dull topic with a lot of previous research already done. You already had 10 articles with the same results, same kind of studies already done. So that is one thing, and there is no context of the research. Like you, like she said, one can be urban-rural differences, or it's not related to your. It is not in context with whatever the research that you are planning. Okay, then sample size. Okay, look for the sample size, whether it is adequate or not for the whatever the conclusions. The important thing is that sample size should be sufficient to draw some conclusion. So if they do not have the sufficient sample size, then obviously even if they have the results, they're not valid results. Okay, so sufficient sample size is not there. Then sometimes they have mentioned only the numbers, no talk, or sometimes all numbers, no talk, no numbers, all talk. It can happen in the abstract. Okay, sometimes poor readability. You cannot make out like what the author wants to say. Okay, that can be one reason. Sometimes sloppiness in the writing, or too many abbreviations are used which you are not used to. Some standard abbreviations, well, they are accepted, but too many abbreviations, then you have to look for like what is this abbreviation that they have used. Okay, so these are the, like, it does not have the interest generated in the article. You do not have that interest. So these may be the reasons based on which the article can be rejected at the abstract stage. Okay, but if you think that it is a good article which can be useful for you, then you can go for the next thing. So after the abstract, so now if you think that it is an okay article, start reading the article. So what is the first part in the journal article? Just now you have finished with the lecture, so you know how to write the research article. Same thing, like what should be the first part in the journal article? Introduction. Okay, that is opening paragraph of the article. So in the opening paragraph, whether the research question specifically stated that you have to find out whatever is the problem area, whether they have identified that problem area or not. Okay, that you should find in opening paragraph. Then is it clear what authors wants to find out? Okay, like what does the author intend to discuss and why he want to discuss that issue? Okay, so that is the second thing that you should find in opening paragraph. And do they make the case that this is an important area for the research inquiry, or in other words, have they mentioned the need of the study? In simple words, have they mentioned like why they want to do the study? So all these things should be there in the opening paragraph. Okay, and the second part after this opening paragraphs is generally the review of literature. But if you see in the journal article, there is no separate heading like review of literature starts from here. Okay, like we do for the dissertation, where you have a separate heading review of literature. In the journal article, it is not separately given, but it is there. Okay, review of literature. So in review of literature, you have to see whether the authors have presented a convincing line of argument. Otherwise, what happens is that they are just name droppings. A topic hai, someone has done the research before and these were their findings. But what is the importance of that article quoting here? Why you are quoting that article here? Okay, it has to be some logic. It should be, when you read the article, it should be like a storytelling. There should be some context why you are placing that article as a review article for your research. So have they given some convincing line of argument, or it is just a name drop? That article might be a good article what they have quoted here, but what is the logic of giving the reference of that article here? Okay, is it related to what context you are talking about? Like in the opening paragraph you mentioned, is it related to that, how it is connected? That you have to see. Then do the authors focus on ideas or merely on discrete facts or findings? जैसे कोई आर्टिकल का रेफरेंस दे दिया, बट वेदर दैट आर्टिकल उसमें सिर्फ हाँ उसमें इतना प्रिवेलेंस मिला था, just numbers there, is that important? No. What concept that they have developed have they mentioned here? Okay, just the numbers won't work in the review of literature. Have they given sufficient attention to the theory? Are the research question or the hypothesis is derivative of the theory and the review of literature? Based on that, like ऐसे study हुआ है, but in my study, this particular area is not yet explored, and that is why I am going to do this research. पहले इतना सब research हो गया है, but this topic has not, like most of the things like ऐसे ऐसे हुआ है, but there is one part which is not investigated. So you would like to do investigation on that particular problem. So what are the research question or the hypothesis that they are developing? It should be derivative of this review of literature. कि क्या पहले study हुआ है, क्या नहीं हुआ है, and what you are going to do. Okay. So it should be a cumulative effort at explaining what you are going to do or what you are going to investigate. Okay. So in short, authors has to set the stage for the research problem that they are reporting. So again, it in a free-flowing manner, it should be opening paragraph with review of literature. What is the context? ऐसे नहीं होता ना कि movie में कि पहले कुछ अलग दिखाया and suddenly something else starts. There has to be some correlation. Hi, opening paragraph हुआ फिर review of literature, कुछ तो context होना चाहिए. Just name dropping should not be there. And based on that, what is your research question? Again, that is not separately mentioned. Okay, need of the study is also not separately mentioned. But if you see in the introduction, first paragraph, introductory paragraph is there, followed by review of literature, though not specifically highlighted, but it is there, and followed by that there is objectives, like then I would like to do in this particular study. What are the objectives of the study, or what is the research question? Okay. So all the introduction and the review of literature, your research question or the objective should be derivative of all the information that is being put forward. Okay. After the review of literature, there is research question. Again, it will not be separate. Most of the journal articles, they will not have the research question, but the objectives will be there. Okay. So research question, it should be a well-developed research question which identifies three important components. The population. So is the population clearly identified in the research question? Okay. In which population you are going to do the study? And what are the variables? The study variables where that they have clearly identified in the research question, the main variable, the secondary variables, all they have clearly identified, and the outcome of the interest. Okay. Along with this, research question should fulfill certain criteria. What is this criteria? Yes. Finer. What is finer criteria? Visibility, interesting, novel, ethical, and relevant. Okay. So all these criteria should be fulfilled by the research question. Okay. Again, this is not specifically highlighted in the research article. If you see, introduction होता है, review of literature होता है, सब एक starting के 2-3 paragraph में होता है, and then what is the next? Yes, methodology. Okay. Now, if you are reviewing any article, okay, suppose you are a reviewer. Most of the times when a neophyte reviewer is there, they will mostly skip the introductory part. अगर जैसे बोला कि criticism means mostly in a negative manner, तो हमें article की चिरफाड़ी कर देनी है अभी, तो this is the section like अब इसमें कुछ गलत निकालते हैं. That is what generally neophyte reviewers do. This is the section where we are going to find the faults. But remember one thing, most of the research, okay, you cannot criticize those research articles for committing certain errors, okay, because whatever we learn in the textbook, research ऐसे होना चाहिए, ऐसे होना चाहिए, ऐसे होना चाहिए, these are the textbook criteria is given which you have learned all throughout these 3 days. Okay. Most of the times practically it is not possible or feasible, we can say. Even when you are doing the dissertation, most of the things will not be practically possible to do. Okay, there are going to be some errors, and you cannot criticize for committing or omitting certain guidelines when a person is doing the research. But what is important, okay, even if you don't follow the textbook guidelines, okay, here what is important is what you are doing, whether it is clearly stated or not. Okay, methodology, ठीक है, you are not able to do जैसे अभी you are doing a case control study, you are not able to do exactly step by step, but whatever you are doing, You have to mention it. Like मैंने ऐसे किया, ऐसे किया, ऐसे किया. Steps. What you have done, it should be clearly mentioned. So do the authors clearly describe their research strategy? Don't go on like इसने textbook में तो ऐसे लिखा है and he has not done like that. But whatever he has done, whether he has done, he has mentioned it correctly or not. Okay. They have to give specific attention, like sample size, from where they have collected the sample, what are the operational measures, whether the measures were adequate or not, what is the external, internal validity, reliability. So all these things you have to look after. So whatever the methods, it should be clearly described. There should be no surprises कि ऐसे हाँ बाद में किया ऐसे किया था मैंने लेकिन लिखा नहीं. It should not be like that. Okay. So whatever is there, they should be mentioned. Sometimes you think that whatever the methodology that they have adopted, some other methodology would have been more suitable. So in this article, whatever the method that they have chosen, whether they have given explanation for that, why they have chosen this particular methodology. If any other methodology is available, whether that is adequate or not, then you can give your explanation. Like what they have done, and this methodology could have been much better to get the results. So that you have to look after. Then sometimes author has to use certain definitions which they have to mention in the methodology, because sometimes the textbook definitions won't work in the research. Say for example migraine. Okay, अभी clinics में if you are sitting in OPD, migraine का patient आया. Okay, now obviously he will present with what is the classical symptom of headache? Sorry, migraine is the headache. Okay, so patient will present with headache. Okay, now you don't need a textbook definition for headache, sorry, migraine, to diagnose the migraine, right? Headache है, okay, you will rule out some possibilities. हाँ ये इसकी वजह से हो रहा है, some eye problems है, or yeah, what are the other problems? So you rule out different things and then you come to know कि अच्छा this is migraine. You don't need the textbook definition of migraine to diagnose the migraine when you are sitting in a OPD. You can trial and error करके बाकी things rule out करके you can come down to the migraine. Okay, but when you are doing the research on migraine, you need some definition for the migraine, whom you will call as a migraine. Suppose it is a large study and there are 5 investigators are there. Okay, I involve 5 centers, 5 clinicians are there at 5 different centers. Now as a clinician, if I feel that this person has migraine, other clinician might not feel that this is because of migraine. Okay, they will differ. अगर स्टडी में भी ऐसे हुआ रिसर्च में, so your findings will not be consistent. So for migraine, okay, if you are doing a research on the migraine, you need to have certain definition of the migraine. If these things are present, then only it will be called as migraine. It will not be exactly like a textbook definition. It will be the definition for your research project. Okay, and this type of definition is called as operational definition, which you are going to use for your research purpose, and that also should have been mentioned in the methodology section if there are any such operational definitions are there. Understood? If you are not using the textbook definition, then you have to form your own definition and put that these are the things that I am going to do. So that should also be mentioned in the methodology section. Okay, after that, what is the next section in the research article? Methodology के बाद, yes, group C. What was the question? Anything interesting in the mobile? Can you switch off the mobile? Yeah. Okay. So what comes after methodology? क्या होता है? Results. Okay. Next part is the result section. Now results is definitely the heart of any research article, right? But again, it is not the soul of the article. Soul you will find in the introductory paragraph and in the discussion section. Okay, so when you read the results section, whether the results they tell a story, actually it is here you will just find the answers to the research question. Okay, so are the tables and figures they are clear and succinct? Sometimes there are too many tables, too many figures, too many diagrams are there. Okay, whether they are sufficient. अगर ज़्यादा table है तो can these tables be combined so that in minimum words the maximum information can be shared with the help of these tables and the diagrams. So can that be done? Okay, so if there are too many tables, figures which can, like, if there are too many information given in the results, what is the important factor that may be missed? Okay, so it should be concise, but clearly it should be mentioned. Also, like too many tables and too many figures, if you see from the publication point of view, because these are mostly the colored diagrams are there, and from publication point of view they are expensive, and that's why you should keep as a minimum number of tables and figures. Okay, but whatever the figures and tables that you are putting, they should be relevant once only. Okay, so whether there are all of them, all the tables, figures, whether they are necessary to convey the message or not, or can some be combined or not, that should be looked after. And whether they are presented, the results presented both statistically and substantially meaningful. Remember, I am saying meaningful, I am not saying statistically significant. As ma'am told in the previous section, कि significant आया तो ही research good है, ऐसे नहीं होता है. Even the non-significant findings, if you do the methodology correctly, even the non-significant doesn't matter, you can present your findings. Okay, because non-significant is also important, is also meaningful. ऐसे नहीं कि significant ही आना चाहिए every time. If you apply the statistical test, I need the significant results. That is not the thing. Okay, so it should be meaningful, statistically meaningful. That means appropriate statistical test should be applied. Then whatever the result you get, you can publish it, no matter whether it is significant or not significant. Okay, so whether these results the authors have stayed within the bounds of the, again, whatever are the guidelines given by the publisher. Okay, so this is the result section. Followed by that there is discussion. Now this is the most important part where the authors can give flight to their ideas. Okay, where their articles will be then can be considered as a cornerstone for many others. It will be cited by many people. So that is the one thing that can happen. But sometimes if it is not there, then nobody will even look after your article. Okay, but if you provide appropriate review, that will help the authors to make some better research next time. So it should not, like, you should always criticize the article, but this is the important part where which decides whether this article can be cited by many people or not. Okay, so it includes the concise and accurate summary of the major findings. Results में already findings आती है. यहाँ पे again you do not have to repeat the same figures. Okay, numbers you put in result section. Here it should be just the concise summary. Okay, then whether they have attempted to integrate these findings in the context of broader scholarly debate about. Now यहाँ पे they should bring back the literature review. Literature review, they have quoted something. So whether they have brought back all those reviewed literature, कि उसमें ये दिया था, now whatever I have found out, these are my findings which are matching with the previous previous research findings, or they are in contrary with the previous research findings. So they have to bring back the reviewed articles that they have put forward. Okay, in the initial section, in the opening section. So have they gone beyond presenting facts, data, and made an effort to present explanations and understanding? Okay, so whether they have found the answers to the research questions, and whether they have just gone beyond presenting the data. Like what new concept has been generated from the research, that should be mentioned here. And do the authors thoughtfully address the limitations of the study? Again, it will come in the discussion section that what are the limitations of the study, whether they have mentioned the limitations or not. Followed by discussion. Generally there is conclusion, but most of the times it is just one last paragraph in the discussion part, like what is the conclusion. It should not be more than one paragraph. Okay. So after that, what is the next section? The keywords abstract के end में आते हैं. After that, keywords are not there. Then comes the references. Okay, so you have to look whether the references, how many are there, whether they are relevant, whether they are recent or not. Okay, remember, for submitting your synopsis, there has to be at least 15 references and they should be recent one. जब भी आप ethical committee के सामने presentation करते हो, there are senior teachers who specifically point out ये research 1990 का है. That won't work. So recent last 5 years के references निकालो. Okay, because when you are presenting in front of scientific committee and ethical committee, okay, there are 8 to 10 senior teachers are sitting, so someone is always pointing out that these are old references. So make sure that the references are recent ones, whether they're important, okay, and what method they have adopted. Okay, there are different methods of writing the references. AP is American Psychological Association, and second one is Vancouver. Vancouver is the one which is very commonly used. You will also use the Vancouver style for referencing. Okay, so for what purpose they have used the references, whether they are used to support your findings or for the counter argument, for what purpose they are being used. So just one example of this APA and Vancouver. APA is also called as in-text citation. So here you can see, here in the text itself, the names of the authors are there. This is APA, American Psychological Association method of writing the references. Okay, and these will be the references. Here just they put the names of the authors, Darwin, Royster, Monroe, and 2002. Okay, and the second one is Thomas, 2004. So this is APA in-text citation. Okay, while the second Vancouver method, which you are commonly going to use. Okay, so here how you write, here just the in Arabic numbers in brackets, the numbers are placed. Okay, and author's name, so surname followed by initials, then title of the article. Okay, if there is comma, if more than 6 authors are there, you write the names of the 6 authors and then full and all at all. Okay, if more than 6, you write the names of the 6 authors and then at all, then full stop, then title of the article. Okay, then title of the journal, publication, year, month, date, followed by semicolon, volume in bracket issue, then page numbers. Okay, this is the ideal method of writing Vancouver style of references. Okay, so make sure that you write this in a Vancouver style. Okay, so all these sections are over. Now at the end, you have to comment on the writing style of the article. So whether the article writing is clear or not. Do the authors communicate their ideas using direct, straightforward, unambiguous words? Okay, so what are the words, phrases they are using? They should not use too many statistical words. Okay, because that will again interfere with the communication with the audience or whoever is reading the article. Okay, too many words, too many paragraphs, that can they be cut down? So it should be clear one. Okay, then it should be concise, because too many words, too many paragraphs, अगर बहुत लंबा 10-12 pages का article होगा तो obviously you are not going to read that article. So whether can it be concise, and it should be correct. Grammatically it should be correct. Like all of you are aware, if you miss the punctuation mark somewhere, then the entire meaning of the word will, entire meaning of the sentence will change. So grammatically you have to be correct, okay, what you write. Otherwise, whatever the message that you want to convey, that won't be conveyed. So grammatically, it should be correct. It should not be like left to the editor to do the job. Okay, you should do it yourself. And what is the effect of the author's language? Okay, whether they are successfully able to communicate what they want to communicate. What is the overall effect that you have to see, whether they are using the words which are neutral, they should not be emotionally charged. Okay, so use of neutral words should be there. So overall, you have to comment on the writing style of the article. Okay. Then after you evaluate this, you have to write down the summary of the article. So you have to summarize. So while summarizing, your goal should be read and understand the article, analyze the findings, and evaluate and comment on the article. That is what you are going to do. So you have to first read the article, give yourself enough time to understand it. Quickly read the article without taking any notes. Just get the main idea. Then identify what is the research question, what is the hypothesis, what is the test of the hypothesis, that means what is the methodology, what are the findings, how they are interpreted, that means what is the discussion. Okay, so identify all these things, then read the article again. This time you can take the notes, highlight the important ideas, you can make the brief notes, and read the article in depth again, and ask yourself few questions like whether what is the interesting, how the authors has supported, what is the main aim, whether it is in timely or the same old topic is repeated, whether the argument is convincing, evidence is valid, how does the study design has addressed this thesis, what are the controls, is the methodology appropriate, or is there are any weaknesses, are the results convincing, is it comprehensive and thorough, what questions remain unanswered or anything omitted, are the findings presented and described clearly and fully, whether there is any other way in which the data could be interpreted, and how it is contributing to the field. Okay, what new knowledge has been developed and how it is related to the course. Then you have to write the summary. Okay, this is what you have done. Now you have to write. There will be 3 sections: introduction, body, and conclusion. So in introduction, you can write the title of the article, what the name of the authors, provide the full bibliographic citation of the article, identify the purpose of the article, then what is the research question, explain why that is important. Then it is important that this introductory paragraph, what you are writing, it should include a thesis statement which identifies the main points that you will be discussing in the analysis. Second part is the analysis of the body. So you can briefly describe methods, design, sample size, variables, how they are measured, and how the research are conducted. Then describe what results they have found. Write the analytical summary of important findings, arguments, or conclusions. Then discuss the strength. So till here, okay, like in a movie review, first they give you the storyline, like what is the story. So till here, you are like what is given in the article. How, okay, and from here starts your evaluation, like what are the strengths or usefulness. Then what are the weaknesses or limitations or problems in the study, and what you learn from the article, and whether you will recommend that article to others. You can support your analysis by giving some examples throughout. And conclusion, you have to summarize the discussion, make a final judgment on the value of the article, how good is the article, and state what you have learned from the article and comment on the future implications of the research. Now, if your critique has more positive than negative points, then present the negative points first and the other way around. Okay, जो कम है वो पहले positive, you will write down these are the positive findings, these are negative points. जो कम है that you will write first, जो ज़्यादा है that will come second. Okay. Now some scoring system, as I told you, like for the different sections, this is one method of giving the scoring on scale of 1 to 10. 1 to 4 will be poor, 5 to 7 will be fair, and 8 to 10 will be excellent. So this is one way. Then either 10, 5, 0. This is another way of giving the scoring, or 2, 1, 0. So these are different scoring systems. Then apart from this, there are standard methods of reporting the articles. Okay, reporting the research studies. Okay, so remember at least these things. Concert, this is for the clinical trials. Okay, you can write down this. These are the 4 things which you should remember, because even if you do this online biomedical course, they will also ask this. Concert is for the clinical trials. Strawberry is for the descriptive and analytical study. Start is for diagnostic tests, and quorum is for meta-analysis. Okay, so this concert, it is consolidated standards of reporting trials, which is for the clinical trials. Okay, concert means consolidated standards of reporting trials. Okay, so there are checklist is there, which is available online. This is the flow chart of doing this. Then STROBE, it stands for strengthening the reporting of observational studies in epidemiology. So this is for descriptive and analytical studies. Okay, STROBE, that is strengthening the reporting of observational studies in epidemiology for descriptive and analytical studies. Again, for that, checklist is available online. How do you do that? So at least you should remember, like this type of studies, what is the standard reporting methods are there. Then START, it stands for standards for the reporting of diagnostic accuracy studies. Okay, so for the diagnostic test, this is done. Standards for the reporting of diagnostic accuracy studies. That is START. Okay. Again, there is a checklist. So chart, and the last one is quorum, which is quality of reporting meta-analysis. So this is for the meta-analysis type of study. Okay, remember these 4 reporting methods: concert, STROBE, START, and quorum. Concert is for clinical trials, STROBE for descriptive analytical studies, START for diagnostic tests, and quorum for meta-analysis study. Okay, these are the different methods. So this was about this critical evaluation of journal articles. So for the next session, we are having group activity. So I will be giving you the one article to each group, and you have to evaluate that article and present the summary of that article. So I will distribute it to you. Okay, so we'll start with this activity. So all other groups, you have to pay attention and see what they are presenting. Start with group D. Okay. Okay, so all other people, they are not aware of what article you are having. Okay, so you have to like first give the summary what article is all about, and then according to the checklist you have to present. Okay, so others, please listen carefully.
Good afternoon, everyone. Our title is Integrated Malaria Vector Control with Microbial Herbicides and Insecticides Treated Net in Western Kenya, a controlled trial.
In short, can you tell what the article is all about?
In our title, there is a clear concept.
Nahin, tell about the article. In short, like what kind of study, what is the type of study, what their activity, what they have actually done in that research. सांगते का तू सांग पटकन त्याला सांग हे पटकन आणि सांग काय तुला कळलं वाचलं ना सांग मग Listen what the article is. So the article is
The controlled trial where they are comparing the use of microbial larvicidal insecticides treated nets and larvicides both are being used on areas and check the rate of malaria before and after the use.
okay. So rate of malaria before and after using the net.
The nets and also larvicidal microbial larvicidals.
Okay. Okay. That is what type of study it is? Randomized control trial.
Yes.
Okay. Can you read what is given in the methodology? Abstract methodology. Yes. Listen the abstract carefully.
Objective: to assess the contribution of both microbial larvicides and insecticide treated nets in terms of reducing malaria incidence in an integrated vector management program in an area moderately endemic for malaria, Western Kenyan highlands. That's the objective. A method they have used is a pre-post control group design was used. Larval and adult vector population were surveyed in 6 separate valley communities are present. And the incidence of plasmodium infection in children 6 months to 13 years of age were measured during the long and short rainy season each year. Baseline data were collected for 17 months, after which bacillus-based larvicides were applied weekly into the aquatic habitat of the 3 valleys for another 19 months. And at around the same time, larvicides were initiated. ITNs, in the sense, insecticide targeted nets were introduced gradually into all study communities by the National Malaria Control Program. The effect of larvicide in ITNs and other determinants of malaria risk was assessed by means of generalized estimate equation. That's the findings.
What is the find?
The findings are, according to the abstract, the risk of acquiring new parasitic infection in children was subsequently and independently reduced by use of ITN. Odds ratio were 0.69, 55% confidence interval, and larvicide application also odds ratio was 0.44 after adjusting for confidence. And conclusion is vector control with microbial larvicides enhance the malaria control achieved with ITNs alone. Anti-larval measures are a promising complement to ITN distribution in economically important highland areas and similar transmission settings in Africa.
This was the article. Okay, so according to the checklist, now you have to give the rating and comment if specific points that you want to say.
Sir, in the title, they haven't mentioned the population group they are targeting.
Okay,
So that's
so
missing.
that means it was only in 0 to 6 to 13
Year-old children
Okay, so they have
in
not.
the hilly area.
Okay, so they have not mentioned about it.
Yes.
Okay. Next.
In abstract, the summary is quite adequate and conclusion is also good enough.
Okay.
The clarity of aim and objective of the study were also good.
Okay. Title they have not mentioned about the study population. Okay, so what on a scale of 0 to 10?
We'll give them 6.
Okay. Then
Abstract we will give them 8. They have adequately mentioned what was supposed to be mentioned. Yeah. We are quite clear with this one. It was carried out. Introduction. In introduction, actually, they mentioned more about what's going on in another republic, like surrounding areas and all. So we were not quite happy with the introduction. They have mentioned about what's going on in Tanzania and everything.
But
So the background is a little not as clear compared to the subject which is going on. It's what we
you are not completely convinced with the introductory part. Okay.
give them 5.
So have they mentioned the research question or the topic and how they have come to the whether that is an important problem area, how they have identified it?
That's not properly mentioned in introduction. That's
Okay.
Study area and all, so it's very nicely mentioned. They have mentioned what kind of challenges they went through, how it's a hilly area, there are lots of experience, and lots of areas for mosquitoes.
Methodology is good. They have explained in detail. Okay.
Give it 9. Product is nice. Eligibility criteria. So the inclusion and exclusion criteria is also pretty straightforward in it.
Mentioned it clearly.
They have mentioned how they have included all the children and those who have been missed out due to they were traveling the next time because they have again come back for the study. That also have been mentioned and also have been the risk has been also calculated for the missing out subjects. So that's good. Give it a 8. There is the comparison group is before and after the introduction of
Same group.
the same group. The clarity of the study design is quite clear. They have mentioned it properly what they are going to do. But in the blinding, as it's malaria, like the blinding is not as effective, but it's not as required here because you can fake malaria. Net use, everyone in the area knew about they were being given nets by the government.
Anyway, they have not done the blinding. Na? Blinding किया ही नहीं होगा.
क्या नहीं. There have been no report of any side effects given after before the children were diagnosed with malaria. They were given drugs according to their vector programs.
Not about the drug.
Yes, but and they haven't mentioned anything about it afterwards or any side effects.
For the results.
So there is one problem with the sample size. The sample size which they included they did not have a baseline value for what was the prevalence of malaria in the area. They just took it 40 to 60%. They haven't given an explanation of why they have taken 40 to 60%, or what's the basis of taking.
Overall for methodology, what score you will give?
Overall 7, sir.
If
Because
you
it's a challenging area and they have did the study very properly. They have included all multiple factors about which needs to be. There was one weakness. They also know the weakness of the studies because there was a non-random allocation of larvicide instances, not as randomized as it's supposed to be. That's
they have mentioned that it is a randomized, but
yes, but larvicide allocation was not random, which they have mentioned. And figures and tables were pretty nice, but some of them were pretty confusing. There are two big tables. They're not as clear and concise as it's supposed to be. So we give it a 6. This project can also be a baseline for future work in malaria control of the country and applying the same methods to other areas of the country, which are similar in geographical factors. So it's a good project which will help in them in future. There is also one problem. The people who funded them, they are the company who are supplying anti-larvicidal agents. So there is a conflict of interest in this. The conclusion was that there was a significant reduction after using both AT or like treated nets and also larvicide, and which has been proved in the
overall like about the language.
The language was pretty straightforward, but it's for the areas which they include and multiple things were like there are lots of hilly areas included. They had used lots of abbreviation for it. It can be pretty confusing because they had normal use abbreviation for every small hilly area and everything which they are doing. There are lots of abbreviation in the whole.
So overall, on a scale of
7.
For the entire article.
Entire article 8. Sir. I was talking about the language.
No, overall for the
8,
entire.
sir. It's a good article and it will help them in the future also. It's a good baseline article for the study.
Okay. Group E.
Good afternoon, everyone. My title is Correlation of HbA1c with serum lipid profile in patients with type 2 diabetes mellitus. Background diabetes mellitus is a heterogeneous group of disease characterized by states of chronic hyperglycemia, resulting from a diversity of etiologies, genetic and environmental factors acting jointly. HbA1c is considered gold standard measures of chronic glycemia in diabetic patients. HbA1c is the main indicator of mean blood glucose level. Dyslipidemia, especially high LDL, is common in diabetes mellitus and strongly associated with poor glycemic control. Objective is to find the correlation of HbA1c with lipid profile in patients with type 2 diabetes mellitus. Material and method used. Total of 60 confirmed cases of type 2 diabetes mellitus were obtained from BIMS and SKR Medicine Department. The sample comprised both males and females of 40 to 60 years. 60 subjects without diabetes of similar age group were taken as control. The parameters were fasting blood glucose, postprandial blood glucose, HbA1c, triglyceride, cholesterol, HDL, LDL, and HDL were studied and compared between the cases between case and control. Observation is fasting blood sugar, postprandial blood sugar, and HbA1c were significantly high in case group. LDL, cholesterol, triglycerides were high in case group as compared to control group. HDL is significantly low compared to control. Result: HbA1c is significantly correlated with lipid profile. Conclusion is type 2 diabetes patients are more prone to dyslipidemia. HbA1c is significantly correlated with lipid profile. So HbA1c can be used as an indirect indicator of dyslipidemia in type 2 diabetes. In addition to as glycemic control biomarker. Keywords were type 2 diabetes mellitus, HbA1c, and lipid profile.
So, go according to the checklist then.
So in the title is clear, but mention type of study is not in the title.
Yes. What type of study is
Case.
case control study? So they have not mentioned about the type of study.
Then the abstract. In the abstract is quite considered as they have mentioned the age group, the main female, and also the control, the number of controls there. In introduction, they have mentioned a line where they have stated that type 2 diabetes mellitus in Indians is being increasingly seen in younger and less obese persons than in Western countries. This is slightly contradictory to the condition which is actually in
The introduction, they have mentioned about aims and objectives clearly.
We have mentioned about objectives, but the aim.
That is objective, like at that why they, what is the need of the study, what they want to do.
Yes,
That is mentioned. Okay. Then methodology.
In methodology, the description of core subjects and steps of the study, including exclusion criteria with information about the comparison method design, clarity of study design is not clear.
The case control.
There is case and control, but what further study? Description of blinding is not adequate.
Variables, have they mentioned about variables?
They have mentioned about variables. There are some tables where they have mentioned about BMI, but they have not mentioned the variable.
You have taken the BMI somewhere, but not mentioned.
Not mentioned about BMI. Then
Is in methodology.
Description of characteristics of enrolled samples and accuracy of samples, like how they have taken the samples is not mentioned.
Sample size, how they have calculated the
It is
sample
not
size,
mentioned.
that is also not.
They have just mentioned 60 cases and 50 points, but I'm not sure. This is the result. Confidence intervals and errors not applicable. Reports of summary statistics for test important not applicable.
Have they mentioned like what test, the statistical test they
Yes,
have
they have
used?
mentioned compared
Okay, so with the tables, are you able to read the tables properly or?
tables and figures are
The discussion?
in discussion and conclusion paragraph, they have mentioned about cardiovascular disease, like we can early diagnose about the HbA1c, it can be helped in cardiovascular, get cardiovascular.
They like develop some new the feature cannot overall manuscript language overall quality on a scale of 1 to 10 for the entire article. Group A. Yes, what article you are having? Huh? Yes, breast cancer. So read the title and the abstract. Loud.
Breast cancer, case control study in tertiary care hospitals. Not
Okay. Abstract.
the abstract is the aim is to identify association of various etiological factors with breast cancer. Second is a hospital test matched case control study of 320 newly diagnosed breast cancer cases and 320 normal healthy individuals constituted the study population. The subjects in the control group were matched individually with the cases for their age plus minus 2 years and socio-economic status. Then the chi-square test and unpaired t-test were used. The significance level of mean age at menarche, higher age at marriage, higher mean age, and the age at last childbirth, and mean duration of breastfeeding. In the title,
They have various reproductive factors and the breast cancer that they have compared. So reproductive factors that they studied were mean age at menarche,
higher age
at
at
marriage,
and mean age at last childbirth,
mean duration of breastfeeding,
number of abortions, age at menopause, oral contraceptive pills, family history of breast cancer.
So these many variables they have used, they have compared in two groups. Okay, so according to the checklist, then
In the title, sir, they have not mentioned the population. The study. Age. Age. The risk factors are also other risk factors like genetic.
title is okay.
Yes, sir.
There was also case control, but they have not mentioned about case control type of study here. They have mentioned that it is a case control study. Then abstract.
Location is also mentioned. Population is also mentioned. They have not mentioned all the like genetic, then history of the.
They have studied, but they have not mentioned the abstract.
They have not studied other risk factors.
That's okay, but if they have studied and not mentioned in abstract, then we can say that abstract is complete. So whatever they have studied, whether it is adequate or not, the abstract is adequate if someone wants to do study on breast cancer. Okay. Then introduction. Whether it was is it clear what they want to study?
Yes, sir.
Objective is mentioned. Review of literature.
Yes, sir.
Okay. Then methodology, as it described, like what is the study population, how they have collected the cases, controls. So controls were not the hospital admitted patients, they were healthy individuals from the community. Have they mentioned inclusion, exclusion criteria?
Yes. They have mentioned the criteria for cases and also for the.
Okay. Any results? Have they mentioned about sample size? How they have calculated? How much they have taken in case and control?
320 cases.
Have they given like 320 only? Not mentioned about how they have calculated the sample size. In the results, the tables, figures, they are appropriate. Can you read it properly?
Yeah.
What the statistical test that they have applied, have they mentioned?
Isolated.
And and
These
they also mentioned in the abstract some correlation. No? Okay. Then in discussion part, what is the conclusion that they have drawn, whether the discussion is appropriate, have they brought back the review of literature and compared their findings with some previous studies? So what is the conclusion?
other risk factors like genetic mutation.
That is, have they mentioned that this is the limitation of the study?
They have not.
Any other limitation that they have mentioned? Okay. So overall, what are the positive points and what are the negative points in this article? Summarize.
The hormonal factors they have mentioned here, but the other factors like genetic mutation or history of radiation.
See, about the research, how they have conducted the research, comment on that. Okay, rather than this factor. So what are the good points? What are the bad points that you think?
Good point is they have mentioned the type of.
Hmm.
They have mentioned the test.
So all the tests you think that you have learned about the statistical test. So what are the tests that they have applied? You think they are appropriate? Okay.
Methodology is also very clear.
Okay.
The next point is they have not mentioned the population age of the population
In the title.
and how they calculate the sample size.
So overall on a scale of 1 to 10, what rating you will give? 7. Okay. Next, group B. केले ना प्रेझेंट एकदा नवीन कोणीतरी दोन्ही वेळेस तेच केलंय का मी पहिल्याच दिवशी सांगितलं प्रत्येक वेळेस कुणीतरी नवीन प्रेझेंट करायचं एकानेच काय करायचं ते By the time they decide who is going to present, are you ready? Huh? कौन present करना है तुमच्या? Yes, who is going to present? लवकर डिसाइड करा. तू केलं ना ऑलरेडी एकदा, मग okay. Group B. What is the title of the article?
Perinatal care practices in home delivery in the rural Bangalore, India, is a community medicine professional survey.
Okay, read the abstract.
The background is a slowing in the decline in neonatal mortality in India has hindered progress made in reducing overall child mortality. The persisting use of the unsafe home deliveries and harmful neonatal practices may contribute to this stagnation in neonatal mortality rate. Method. A community-based cross-sectional study of mothers residing in rural Bangalore, India, who had given birth within 42 days of the home visit, had done during 2013 and 14. A trained health workers interviewed women who delivered a home about perinatal care practices. The questionnaire used was adapted from previous studies assessing perinatal care practices according to the WHO guidelines, and a descriptive analysis of perinatal practices were reported as effective. The association of various factors with outcomes such as clean-cut care, thermal care, and early initiation of breastfeeding is assessed using multivariate logistic regression.
Result. Result. Read the result.
The abstract, title, in title they have not mentioned the population.
First read the results of the abstract.
A total of 2,230 deliveries, 945 took place in the hospital, while the remainder were at the home. Among home deliveries, only 30% were attended by the skilled workers. A safe delivery kit was used in 40%, and 47% of the attendants had washed their hands before delivery. In most of the cases, 94%, the umbilical cord was cut after the delivery from the placenta, and a non-sterile instrument was used in 26% of the birth. Harmful practices of applications on the cord plumb 55%, bathing within 6 hours, prenatal feeding in 30%, and delayed initiation of breastfeeding 73% were reported. Wrapping was usually delayed, and most 64% of neonates were wrapped between the 10 minutes and 16 minutes after the birth. Being Hindu was positively associated with good perinatal care practices, and attending antenatal care at least once was associated with clean cord care and early breastfeeding. Having a trained birth attendant at delivery was associated only with the clean cord care, and having a medical doctor or nurse in attendance was associated with only early initiation of the breastfeeding. Being a member of scheduled tribe, caste or type was positively associated with clean cord care and thermal care.
The conclusion.
Appropriate and culturally acceptable behavioral change communication strategies are needed to improve the delivery and neonatal care practices in Bangalore.
Okay. According to the checklist, title, abstract, introduction, methodology, result, discussion.
So in title, they have not mentioned the
Rural Bangalore, village of Bangalore.
Sir,
The title, it is clear, concise. Okay, then abstract. Is your comment about the abstract?
the background and method is good, but in result they have mentioned about the
Cannot say what are the findings that they have mentioned. What I found is that there are too many figures where their result section, we could have combined it. Yeah. Then introduction and review of literature. So have they mentioned the need of the study? Objective of the study, review of literature was good. Result, method of
method. Study setting was the study was carried in study design is cross-sectional study. All women who resided in field practice area who had given the birth, they
Your and what do you think whether they are said correctly or any other have been mentioned? Your evaluation,
mentioned
inclusion, exclusion criteria,
also who are resided in Bangalore.
they mentioned it correctly.
Yes, sir.
Don't read out. I know it's given. Variables, have they mentioned about different variables?
Yes.
In results, have they applied any statistical test? It is just a descriptive type of study. How they have described the tables, the figures are there. Are they appropriate, easily understandable? Then in discussion, how is the discussion? Your comments about the discussion.
This one the delivery who took place at the home.
Don't read out. When I ask you something, you just go on reading something from the article. Don't read out the article. You take your observations, what do you feel?
The discussion and clarity.
You have not read the article at all. Just now you are going through the article or you will be the whatever. Shall we move to the next group because you are not prepared at all? So group B, group C.
Good afternoon, everyone. My topic is CT and MR imaging findings in adults with cerebral medulloblastoma and its comparison with findings in children. So simultaneously, we have studied CT and MRI imaging findings in patients with medulloblastoma and also CT and MRI findings in adults and children. There are two studies simultaneously.
So CT and MRI imaging finding in adults and then in comparison with the findings in children.
Yes. So the title is clear enough and concise enough.
Type of study have they mentioned?
So they haven't mentioned the type of study, but observational case control.
How can it be observational as well as case control? Case control study, it can be okay. So analytical study, case control study. You can just say case control study, not the observation. What are the cases and what are the controls?
So the proven histopathologically proven cases of cerebral medulloblastoma was studied. Before the all the patients had a posterior fossa, a mass, and then they were operated. Then the histopathological study was done, and they were proven to be medulloblastoma. And the imaging was done before the surgery.
So what are the cases and what are the controls?
No control.
Then how can it be case control study? So is it clear like what type of study it is?
Description.
Just read out the abstract so that we can get some idea.
The goal of this study was to determine if certain imaging features suggest the diagnosis of cerebral medulloblastoma in adults, and to determine how often the classic CT appearance seen in children is present in adults. The study included 28 adult patients with proved cerebral medulloblastoma. The tumor was located in the cerebral vermis in 14 patients and in cerebral hemisphere in 14 patients. 13 patients had unenhanced CT of the brain, all had CECT, and 8 had unenhanced MR imaging. The imaging features in adults were compared with those in children as described in this literature. In our adult patients, all tumors were hyperdense compared with gray matter on unenhanced CT and showed a slight to moderate increase in density after injection of contrast medium. 13 lesions had well-defined margins and 15 had poorly defined margins.
So it is just a descriptive cross-sectional study. Title, then title, abstract, methodology.
So the abstract is well enough. It gives clear-cut presentation of what the
Title, about the title.
the title is clear and concise.
Yeah. About the type of the study.
So the type of study.
Okay. Then abstract.
The abstract is well enough. It gives the gist of all the studies they have done.
But they have not like subdivided the abstract into different headings. Okay. Then introduction and review of literature. Have they mentioned about the need of the study?
So they haven't made. So it's not adequate.
Introduction. Have they mentioned the need of the study? Objective of the study, why they want to do this? Is it clear?
So they wanted to see the how strong association the imaging has with the diagnosis.
Pathological जो diagnosis है,
with
how
the
it
imaging
is CT and MRI imaging, how it is correlated in adults and
and
children.
in children. And also the adult and children
Comparison between adults and children. Okay. So it is not clear in the introduction part.
Right.
Okay. Now methodology, study setting, subjects that they have included, inclusion exclusion criteria.
Yes, sir. Inclusion criteria, all patients who had mass and posterior scrotum was studied. And
That should be pathologically confirmed. Then only, na?
yes,
Then,
and they had done imaging before prior to the surgery. So
Okay.
if the patients were not,
so whatever the subject that they have enrolled for the study, have they mentioned clearly about whom to include, who are the study
inclusion
subjects,
criteria is quite clear.
okay, study settings where they
And
have
but
conducted,
the exclusion criteria is
mentioned.
not mentioned.
Study settings where they have conducted this study.
No. The two neuroradiologists were involved in this.
That's it. Then about the variables, have they mentioned about the
Yes, but the
variables?
variables are quite clear. Clearly mentioned.
Okay. Then results,
So the CT and MRI imaging are clearly given, but the results are not tabulated.
not even a single table is there.
No,
Okay,
the CT and MRI imaging are properly.
okay. But they have not mentioned about, no tables are there.
No,
So all theoretical part is there.
yes,
Have they applied any statistical test?
no, sir.
Just a descriptive study.
Yes.
Then how they have compared,
So 28 patients were included in the study. And
so
out of
is that
them-
sample size sufficient?
Yes.
Sufficient. Have they mentioned about calculation of sample size?
No.
How can you say it is adequate or sufficient?
It's rare to
Yes, rare, but then even 10 cases would do, no? If it is that rare. As we discussed in the morning session, whatever you should have some proof, like why 28 only. Okay? Have they applied any statistical test? No. Just the description.
only dis-
Okay. Any discussion? Any new thing that they have developed?
yes, sir. They have properly given to the children, and 11% of the children had the characteristics of that.
Okay.
MRI.
Is there lesions similar to adults?
Yes,
Okay. So what they have concluded, like these are the findings. So what next? What is the use? जो भी मिला है उसका कुछ use तो होना चाहिए. Then only it will be called as research. Research. What concept they have developed? अच्छा इसमें ये findings मिले, उसमें वो findings मिले, ये हो गया, सब हो गया. आगे क्या?
so that is not.
So nothing, just they have done the study, but what is the use then? It should be useful ना. तो उसके आगे क्या? उसका use क्या? अच्छा ठीक है, CT MRI में ये findings मिलते हैं, फिर उसका क्या? So it should have been clear. So discussion में वो नहीं है तो it's of no use. Just doing the study and just presenting the number.
They have just descriptive.
In very discussion they have not mentioned. Okay. Limitations have they mentioned?
So yes, sir, they have mentioned that the imaging studies are non-specific. So
Since we cannot rely on
Rely
CT
on-
and imaging. Okay. Limitations, have they mentioned about limitations? This is the limitation. I thought you are saying that this is what they have concluded, that they are not non-specific. Okay. You know, overall style of presentation, overall quality.
So it is very haphazardly present.
So on a scale of 1 to 10, what score you will give?
5 to 6.
Still, if there is nothing new, new knowledge are not developed still.
But new knowledge is developed, but the way of presentation.
What new knowledge? They have just presented the facts. You said कि discussion में कुछ है ही नहीं कि क्या conclude क्या किया कि ठीक है CT MRI किया on in medulloblastoma patient, but फिर क्या आगे क्या किया प्रेजेंट इसमें इतना आया उसमें इतना आया ये दिखा वो दिखा दैट्स इट उसके आगे क्या कुछ तो कंक्लूड होना चाहिए निकलना चाहिए कि हाँ फिर इज दिस यूजफुल नॉट यूजफुल इट शुड बी यूज्ड पैथोलॉजिकल में फिर वो ये करना पड़ेगा ना क्या एफएनएससी या बायोप्सी या सब इंटरवेंशन करके निकालना पड़ेगा वो टिश्यू जो भी है उसके लिए अगर इससे वो सीटी हमारा ऐसे अगर कंफर्म कर सकते डायग्नोसिस तो उसकी जरूरत नहीं पड़ेगी बिकॉज ब्रेन से लेना मतलब इट विल बी अ रिस्की प्रोसीजर अगर एफएनएससी या कुछ लेना है टिश्यू वहां से तो राइट तो ऐसा कुछ होना चाहिए ना कि हाँ नहीं इससे भी कंफर्म कर सकते हैं डायग्नोसिस नो नीड ऑफ डूइंग एनी इंटरवेंशन तो ऐसा कुछ निकल के आना चाहिए ना कि व्हाट इज द कंक्लूजन एट दैट सिर्फ किया सीटी हमारे क्या 28 इसमें ये किया अडल्ट में क्या चिल्ड्रन में क्या बस हो गया ओके सो डिस्कशन का इंपॉर्टेंस वही है कि व्हाट न्यू कंसेप्ट इज डेवलप्ड व्हाट इज कंक्लूजन ओके तो स्टिल लाइक 10 में से 5 देने पास कर देने नहीं होता ना ओके so with this we come to the end of this 3 days workshop. I hope you have learned something new, if not all the things. Yes or no?